Among the technical facts he gathered, Professor Starnes also offered some rather unscientific hypotheses. Let's see them.
Somebody could describe to me the identity of this gender cookie.
Hello, this would be someone who was assigned male at birth.
Your child is going to say, you know, this was a mistake, and we just talked it through. What is testosterone going to do for the next 5 years? And it's your child's going to have a lower voice, and is going to have maybe a little bit of facial hair here.
This video showcases a personal account of someone who has been diagnosed with hypogonadism, hypogonadism, also known as Kallmann syndrome, a type of disorder of sex development, DSD, similar to Turner's syndrome, XO, and Klinefelter's syndrome, XX. People with these conditions may experience other developmental difficulties throughout their lives, such as learning disabilities, speech impairments, heart problems, kidney issues, infertility, and rheumatoid arthritis. Hypogonadism, hypogonadism is a congenital condition and can also be induced by the use of puberty blockers such as Lupron. These conditions are protected under the Americans with Disabilities Act, which mandates the disclosure of such condition.
Mystery Science Theater 3000.
Hey guys, it's Tom Servo from Mystery Science Theater 3000, and boy, do I have a doozy for you today. This week's film is Transgender Health and Gender-Affirming Care with Katie Couric, Joshua Safer, and Marcy Bowers. It's a real treat, trust me. So the plot of this docudrama from the early 2020s is that a group of doctors are involved in something called gender-affirming care. It involves children drugs and surgeries in an attempt to fit them into social categories known as gender. I know it sounds like science fiction, but they're very serious. Just a heads up. In this video, we will discuss some sensitive topics. If you are a sensitive viewer, please be aware and proceed with caution. There will also be a fair amount of recreational alcohol and drug use, which will be done by me. The Truther will also be giving presentations on the forgotten science behind these hormones and stuff. So, may get a little jarring. If you're easily offended, which is basically everyone these days, and you find caricatures of people like this one offensive, please stop this video and return to your anime. Otherwise, we will be starting out with a luncheon with the top specialists who are the people in charge of authoring and maintaining the standards for gender medicine. Keep your ear open to how they introduce the topic and whether or not they define any of their terms.
So let's fast forward from 2016 when I did that documentary and met both of you for the first time to today. The number of young people, as many probably at this table know, who identify as trans has nearly doubled in recent years, according to one study.
That is a really low estimate.
I guess this is based on a variety of CDC surveys. And according to those surveys, an estimated 1.4% of 13 to 17-year-olds and 1.3% of 18 to 24-year-olds are transgender, compared to 0.05% of adults. Clearly, we're witnessing this generational shift with more people feeling comfortable coming forward and talking about this. But can you all take a moment and give me your perspective, give all of us your perspective about these rising numbers and what you think is going on here, in addition to perhaps societal acceptance and greater awareness? And Josh.
Trans persons have been around since the beginning of time, but it's a very, very difficult topic and a very difficult journey to take for people, as it still is. And but it's finally, we've reached societal maturity, I'll call it, where we've been able to address the issue. We hope it doesn't get turned back and put everybody back in their gender boxes. You know, you're assigned at birth, either male or female, and you go in your gender box, and a lot of people would like you to stay there forever. That's not the way the world is. I'll be quiet.
Your awareness. And Josh, why don't you start?
So to me, I think saying in addition to societal acceptance,
Is this a pitch meaning? Sounds like they're trying to sell timeshares.
I don't know. I don't know if it's more than that. Honestly, that is, and to my brain, no matter how I'm thinking about things in terms of biology of gender identity, etc., these things have always been there, and so really all we're doing is creating safer and safer spaces and seeing that, which like I just said, has been there all along.
What do you think, Marcy?
Yeah, I think that's absolutely right. I mean, this is my little talking point, but all genitals are from the same tissues. All adult men have testosterone or have estrogen, and all adult women have estrogen, have testosterone. And each male goes through a period where the genitals are female. So what people are trying to express is this
I don't know why Marcy keeps mentioning genitals. I have a feeling this will not end well.
Genetics, from hormones, from experiential issues, trauma. This has an impact on how someone perceives themselves to be male or female. And so this is what this generation is trying to express, is that the idea of just defining them by male or female.
What forces might be at work?
Katie is referring to the Force in Star Wars.
Force? The Force is what gives the Jedi his power. It's an energy field created by all living things.
Marcy, that you just described in terms of in utero development, some kind of hormonal bath or whatever that may be resulting in this, in someone feeling trans, or is it so multifactorial, it's just hard to pinpoint?
You know, we had such a long conversation this morning. There's many ways you could look into it. Like, is there a gene? Well, that would be really going the wrong direction. Or is there something you can see on ultrasound? There probably is an area of gender identity that can be identified by brain MRI scans, and that's been shown that trans women look like cisgender women in the brain in this one particular area. Is that it's really, we should be embracing this as diversity always makes the world better, and it's just, this is just one more fantastic, positive, open-ended opportunity that the world is beginning to explore. We don't want to shut that down. And
I want to take an issue, though, with the idea of taking a step back. Gender identity and all the components, and notably whatever those
Joshua reminds me of Lex Luthor.
May include, you know, maybe a gene is too simplistic, but whatever those components are, including things that are influenced by your environment, which are still biological components, if you think about it, those are all of great interest to me, and it's not even focused only on transgender people, because I think we all have gender identity. And it's just that depending upon where your gender identity fits relative to some of your other biology, you may or may not have noticed. And as we take a step back and think about this more, then there's more capacity for us.
Never mind Lex Luthor. I take that back. Forget I mentioned it.
But we don't want to push. We don't want to learn so that we can correct something or push people back in their gender boxes. That isn't the.
Oh, exactly. That's
Mercy seems not interested in helping people feel comfortable in their own bodies.
I don't know what the appropriate analogy are. You know, the simplistic analogy is eye color. We're not learning about all the biology that goes into the components of the eye because we're going to fix one. You know,
unless there was something called eye color dysphoria.
Yeah. Let's
almost immutable is the idea of gender identity. And you get that when you read the personal accounts of people who have had trans kids. There's just no way. They're just winning a losing battle. They try to reinforce assigned gender norms.
Maybe you could change the gender norms first.
And stress, and it's an everyday thing. And finally, when they finally give in to their child, things are better. Grades improve. Their mental health is better. And this is what happens over and over again.
I now turn you over to our next consultant, Jack Turban, an established authority in the study of gender and a prolific writer on the topic. He might be able to help.
Youth. And it gives us 4 basic terms that you'll need to know for the rest of the talk. The first term is sex assigned at birth. More recently, folks have started using the term gender assigned at birth. So this refers to what the doctor says generally when a baby is born, or based on prenatal ultrasound, usually based on external genitalia. So male, female,
toy teddy
or
bear. Did Jack
having a
get
difference of
his
sexual
medical
development.
degree from Toys R
That's sex
Us?
assigned at birth or gender assigned at birth. As you're probably aware, that is different from gender identity. So gender identity is one's psychological sense of their gender, be that male, female, or otherwise. And for transgender folks, their gender identity is different from that which is expected based on societal expectations due to their sex assigned at birth.
So
Gender
society
identity is also different from
expectations
gender
require
expression.
pediatric
So gender
medical
expression
intervention.
is the way you present to
Gotcha.
the world in a gendered way. So I have short hair, I'm wearing pants. That in our culture is generally considered to be a male gender expression. If I wore a dress and had my nails painted, that would be thought of as a more feminine
Hey
gender
guys,
expression.
it's time for a
And of course, all these
presentation.
things are
Take it
culturally
away,
bound.
Truther.
Jack Turban makes it seem like we all accept the assumptions underlying Jack's gender-related descriptions when he explains its components. But I want to move this discussion away from the paradigm of medical psychiatry and towards the paradigm of religious belief. By doing so, we can better comprehend the mechanisms at play in Jack's gender-related descriptions. All major religions and religious cults share these commonalities. Authoritarian groups' use of them for disastrous effects is the only time we take notice of them. Therefore, I will begin with two of the most widely practiced religions. The first of these is a belief that is founded on acquired knowledge, while the other is a faith that is founded on theism. What makes up a religion? Ideology is based on improving society as a whole. Religions have a component of personal transformation. Rather than discussing the truth claims made by various religions, we'll just look at religion in its practical context, to the workings of human nature, drives, and what its constituent parts are. The Catholic faith is on the left, and Buddhism is on the right. One way of looking at a broad topic such as religion is to look at two examples and try to draw parallels to current belief systems. Both illustrate something that religion does that ideology does not, which is a form of personal transformation. In Buddhism, you'll see that the Buddhas are in embrace and are basically making love. This is a visualization of a state called nirvana, and these two beings represent the orgasmic bliss that if you follow the path of Buddha and practice meditation, you'll be able to realize this type of bliss. It's explained in a visual form. The one in back represents wisdom, and his consort symbolizes compassion. And when these two are united together, which is a compassion for all beings and the wisdom, this becomes enlightenment. This is how this state feels. It feels orgasmic. It's a personal transformation into an orgasmic state of existence that is beyond suffering. We see Catholicism. This is the ecstasy of Saint Teresa. So the rays coming down represent God's word is fire. So God's word is fire. And the angel represents a messenger from God. This angel has pierced Saint Teresa in the heart, causing an orgasmic type, or one would say a euphoric type state within Saint Teresa. And this is seen as a transformation of her normal state of human being into the divine state of being in the presence of God. So it's a visual representation of a state that is achieved if you follow God's word, as well as if you follow Buddha's path. This is a visualize of the state of enlightenment. So these are both products of the mind. They happen in the spiritual realm, not in the physical realm. Religion set up what is called a parasocial relationship between devotee and the devotional object. This establishes relationship with the object of devotion, whether it's a guru or a set of beliefs and identities. Just like a real-world relationship, this parasocial relationship is difficult to end because people organize their reality and get their wants and needs met around the tenets of the religion. When you combine that with a society that endorses and gives status to the individuals following the identity that the belief bestows, then it becomes very difficult to break. In this way, religion offers an idealized alternative to a broken family. It is unconditional love that is safe from the toxicity of human neurosis. According to Jonathan Haidt, belief blinds and then binds. This explains the rapid spread of religions that seem to fulfill all these criteria despite the obvious implausibility of their key tenets. There's also another component. That's in and religion called status. You can think of status as a form of manufactured identity. Status or identity in religion is conveyed by faith and enforced by society. For example, in Buddhism, a guru would hold a position in government. In Catholicism, priests and bishops are the authorities. The Pope was seen as the authority on issues, both political and spiritual. Today, those positions are held by people who achieve something within the religious institutions. However, traditionally, they were bestowed by decree. So religion creates these identities out of faith. For example, in ancient Israel, a person who had the name like Cohen, or Katz or Kohanim, which was considered priestly and had religious special rights. This is like using the terms non-binary, queer, and trans as a mark of distinction. This is an important part of religion because it offers a glimpse of the mechanism of how religion replicates itself. In other words, societal authority, because of the status citizens receive being part of that religion and practicing that religion and obeying its tenets. So these religious images act as physical representation of authority and to teach people and to convey the sense of spiritual achievement, whether it's mental state that is achieved or a heavenly afterlife with God. Remember, how can transgenderism's gender journey become a religious experience for those recruited into the faith? Let's have a look at Jack's explanation of terminology and the concepts of the gender path that contribute to this sense of religious commitment. We have these doctrines. So we have gender identity, we have attraction, we have gender expression, and we have biological sex or just gender. These are the foundational elements of the gender journey. We also have terms like cis, pronouns, AFAB and AMAB, acronyms meaning assigned female, male at birth. This is a way defining in-group and out-group. We also have eschatological terms such as trans, genocide, suicide threats, and questioning one's existence. These terms provide a way of enforcing gender orthodoxy on their followers as well as a defense against the belief's critics. An example of a gender identity object of devotion is this gender bear or gender unicorn. They also serve as recruitment and explanation tools for the pillars of the gender journey. Similar to Buddhist statues and Christian art of saints and sinners, these diagrams present the devotee with an easy-to-understand concept of what it means to pursue your real gender on your journey. So let's look at the way these truth claims are put together for the believer. You balance all these things together, you get a state of gender euphoria. So we go from balancing these two states to the state of gender euphoria. And gender euphoria, I would argue, is the goal of gender identity faith. It represents the endpoint of gender journey like nirvana or heaven. This actually has a personal transformation component which separates itself from political ideologies and puts it into a neo-religion. Now, I use the words neo-religion because cult is a loaded word, and we're not judging the doctrines of this belief right now. So what transformation is gender euphoria? We see here with Elliot Page, it says the euphoria of Elliot Page. This relies on personal testimonials. So if you read the Bible, you'll read about personal testimonials about people who are finding Jesus, who are going into God's light, or in Buddhist scriptures, you will read about gurus and yogis who follow the path and their experience of transformation in those religions. Their scriptures written papyrus and tablets spread slowly through society. Today we have Instagram and Tumblr promoting rapid spread of personal narratives and stories of redemption. Here we see Elliot Page testifying of the euphoria she's feeling, the personal transformation when she got all of these gender identity, attraction, and gender expression, and she synced all these together. She gets the state of euphoria. It illustrates to the new recruit what they will experience if they follow the path, which is the realization of the central belief of gender-affirming care, namely gender identity, in a similar manner to the Christian doctrine of the resurrection and the Buddhist doctrine of emptiness. All of these serve the same basic purposes. To place it in context here, we see a quote by a Spanish transgender activist who basically said, "Of belonging arises when we are perceived by others the same way as we perceive ourselves, and when that which is perceived is given a positive value. Positive gender belonging is gender euphoria. Gender identity requires that the larger society and community acknowledge and cherish this internal state. Any questioning is interpreted as transphobic. You can think of transphobia as the belief's idea of evil."
Hey, man, sorry to intrude. I was just moozing inside the Castro, minding my own business when I saw this stray dog just wandering around looking all sad and lonely. And I thought to myself, why not make myself a new companion? So I said to myself, why not roll a ripping Labrador doobie, you know, like a Mary Warner, but richer? Took about 2 days of following that dog around with a little baggie.
That dog is white. Labradors are black.
Do I look like a vet to you? No way, man. But don't worry. The dog's going to be fine in a few days. Well, I need to get ripped. I'll let you get back to your presentation.
Transformations. We see the personal transformation of St. Teresa on one side, and we see the personal transformation on Elliot Page on the other side. And it says Euphoria, Elliot Page. Basically, Elliot Page has a point of her gender journey, and she has come into the light of gender euphoria. Let's have a look at a video from a transgender advocacy website that shows people reaching gender euphoria following their gender journey. The description of the video we're about to watch reads, a video of inspiring stories from transgender people who found happiness by embracing their true selves, by embracing their gender journey. Look for the usage of words like gender euphoria, cis pronouns, and other terminology in the video, as well as the effect it has on the believers.
There's no way to describe it to someone that doesn't experience it, because it's just such a unique, such a personal experience as well. Like, everyone experiences it differently.
Just really small things. William, they, them, like using my pronouns. Like immediately like, oh my God, you see me. Thank you. It's just immediate joy.
4 months into HRT, when I looked in the mirror one morning and I just saw more woman than man, and it was an amazing feeling. Suddenly sort of matching up.
Binding my chest, I gained such relief and such comfort. Sometimes I'm like caught out by my friends just rubbing my chest, and people are like, Gunny, and I'm like, sorry, it just feels so good. It's the small things. It's the people in my life who are important to me, recognizing and using and respecting my pronouns. Strangers on the street asking my pronouns before just assuming my gender. So exciting.
Or it's just like feeling really settled and kind of comfortable with where my body is and how people see.
Some of the people in the gender euphoria video mentioned cosmetic surgery, so I'll discuss some of the reasons why people who are on their gender journey eventually have it. Allow me to provide you with a brief history of body modification. So now I'm going to talk about how different cultures have used altering the body to demonstrate status or religious devotion throughout history, because body alteration can be seen on every continent since the earliest civilizations. This is a type of religious devotion that is conducted on one's own body. In the video you saw a person talk about removing their breasts, and they were quite enthusiastic about this, which is considered top surgery. What exactly is this? What exactly is going on within the minds of these people? Why are they changing their bodies? Can give believers a sense of gender euphoria. So let's talk about one example called Chinese foot binding. Even if it is difficult to imagine ourselves in the mind of a culture with such religious devotion from the past, this will be an excellent illustration of a practice similar to this of altering the body to match status or social norms and to comply with belief. Chinese foot binding is about 1,000 years old, and it was relatively recently discontinued within the last 100 years or so. Chinese foot binding started with the aristocracy. This is taken from Wikipedia. Foot binding was a Chinese practice of breaking and tightly binding young girls' feet in order to change their shape and size. Lotus feet were feet that had been altered by foot binding, and lotus shoes were shoes made for these feet. Bound feet were considered a status symbol and a sign of feminine beauty in late imperial China. It may have started with the Tang dynasty court dancer Yin Yan, or more broadly with the Turk dancers who performed there during the 10th century CE. These dancers were known for their small feet and bow shoes with upturned toes. Lotus shoes are a form of spiritual motivation because these performers' feet resemble lotus, and lotus is a symbol in the East. Lotus emerges from the mud. It was regarded as a symbol of both rising social status and spiritual purity. Buddhists sit atop lotus flowers. As a result, this is a very symbolic as well as feminine beauty, which is also a status symbol. What they're talking about here, you can see a girl, which is what they meant by feminine beauty, that she's a very pretty girl dressed in traditional Confucius garb, with eternal not, which is symbolic rebirth. She's looking in the mirror and at herself, and she has those itty-bitty feet. And this was regarded as high status. It wasn't the deformed feet themselves, but the unusual appearance, which some contemporary Chinese philosophers thought was cruel and wanted it stopped, probably pointing at the industry that produced the lotus shoes as a primary source of perpetuation of the belief. But it was passed down from mother to daughter. The mothers, you see, would bind the child's feet. This was passed down through the generations. Chinese foot binding is similar in motivation and symbolism to a 20,000-year-old practice, a 20,000-year-old skull image. This 20,000-year-old skull is also deformed and elongated for a similar purpose. This elongated skull was viewed as altering one's body as a status symbol. The Romans documented this. The ancient civilization would tie boards on baby skulls and tighten the boards until it was elongated, stretching the skulls out because baby skulls are very soft and can be molded. So that's how they got that particular look. Not extraterrestrial aliens like what popular culture thought these skulls originate from. And, once again, that demonstrated status and power within communities. As Homo sapiens, we modify our bodies to fit our environments and beliefs, as well as to gain some sort of status symbol advantage. Here is a relatively recent example: the Skoptsi, a Russian Christian castration cult that held the fanatical belief that Mark of Cain, which was an Iron Age sacrifice narrative found in the Old Testament. The Skoptsi believed the Mark of Cain was actually physically human genitals and breasts. They actually believed if they cut those off and nullified the body, essentially they would return to the original unfallen state of Adam, which is the purest state of existence. So they would return to Adam and Eve before the fall and recreate paradise on earth. This was their belief, and they would use iron rods and no anesthetic. That was how powerful their belief was. And this was 150 years ago. Physical manifestations, according to the Russian Skoptsi, is a form of religious devotion. It is the outward manifestation of an inner spiritual accomplishment, or the outside castration induces the spiritual accomplishment. The spirit made manifest through physical manifestations, the word made flesh. Russian Skopts described their experiences as blissful after they had gotten rid of their genitalia. One of the most obvious features that links us to the animal kingdom is genitalia. Biological sex directly connects us to all of the animals around us. Nature is tamed by controlling reproduction. Similar castration practices were part of Christian communities going all the way back to the Roman era. Although they weren't widely practiced or considered doctrinal, we have a surviving practice called circumcision, which is an ancient Egyptian practice that distinguished the elite priest in charge of mummification from the ordinary Egyptian priests. This survives today as part of a Jewish tradition dating back to a time of the Iron Age god Yahweh. This distinguished the Jewish devotees from their Gentile counterparts. The Romans were very sexually promiscuous and had sexually explicit materials often depicted in their homes. This was probably a way for Jews and Christians to separate itself from the pagan Romans when Rome became Christian around Constantine time. Circumcision is minor alteration by far, but still based on faith. Like many religious beliefs, it's been changed and adopted over time to the changing cultural landscape. The important point is that the devotion practice of castration and Chinese foot binding and the deformation of skull altogether, they dates back 20,000 years in terms of religious practice, altering the physical body with surgical type instruments for religious purposes, attaining purity and committing to the religion and distinguishing one's own religious sect and beliefs from another. When you change your own body, you commit to the belief that once you change it, you can't go back. If we zoom out, we can see what's going on here. The chest binding is a belief that a chest binder is binding the chest, deforming the breast to mimic the boy's chest. And this is based on gender identity beliefs, which holds an inner gender is so important that the body must conform. This is called gender affirmation care, and a part of this practice. The Skoptsi, who believe in a return to purity and a return to Eden above, they base their beliefs on an interpretation of an Iron Age creation story. Above that is the 20,000-year-old skull. It's probably based on a religious commitment and a show of status. So the images here range from 20,000 years ago to 2021, and I see the same thing happening. It just keeps on happening. People who are trapped in belief or a society demanding conformity are attempting to advance in that society. The belief in a physical form of escaping misogyny or finding a way to relieve pain but based on unproven beliefs and traditions who are under great social pressure to conform. And this is exactly what they do. Elliot Page, as you can see, she's cut her breasts, and she's a status symbol, so that's a strong signal to other girls. Imitate me, you'll be elevated to the same level as I am, so that's why I put these two together, as well as the girl who tied her chest together. You see the girl with the small feet, as well as her mother and adolescents, following the surgeon who performed the nullification surgery. Do you see any similarities between the girl staring at herself in the mirror and noticing that she has small feet and the girl pictured with her mother below who has scarring from surgery? They were both horribly scarred as a result of what their mothers did to them in accordance with their beliefs. People looking for social status and belonging. With all of these concepts and gender identities, the vocabulary and terminology evolved.
Dude, you won't believe what just happened. I had this crazy accident, man. I exploded. Did you see it? Can you believe that? But like, I did some research and I found out that it's because I can get all hot when I smoke, you know. The candy inside starts expanding and boom, the whole thing.
But here's the thing, man. The government's been trying to cover it all up. That's why you see those tinfoils on candy dispensers. It's to block the sun and keep the candy from getting too hot. Crazy, right? Time for another cue drop.
Oh, that's interesting. Are you Q?
But like, forget I even said anything, man. Memory hole, what? I just told you. There are big G spies everywhere. Sorry, man, I'm so fucked up. I'll let you get back to your presentation.
The vocabulary and terminology evolved with the religion. I know there's a lot more to this, like misogyny and mental health, easy available porn. For more information, take a look at Kelly, Jake Keane, Pete Trans, and gender through a broader lens. I also included this tweet by Jack Turban. The tweet says, to deal with chest dysphoria, many transgender youth wear chest bindings. People focus on the risks, but we should also focus on the benefits and how to bind safely. So I placed this tweet right next to the girl whose mother has bound their feet since they were a child. It is not as strenuous of a practice. It's the same procedure. This procedure was known as chest ironing in Central Africa, and girls used it to defend themselves against sexual assault. It is prohibited in many African countries and is considered violence against women. This is referred to as chest binding by Jack Turban. Chest ironing is referred to as violence against women in African countries. This brings us to the end of our very brief discussion of religion. I hope I made a strong case for the religious underpinnings of gender identity and gender-affirming care. Philosophers and religious studies specialists may disagree. Religion is the ultimate social contagion and what has been called the default thinking of the human mind. It is a fundamental concept in understanding human nature, organizing society, gaining power, and coping with fear. Affirmative care is based on the notion that a person's gender identity is a fixed feature of them. When Marcy Bauer said, "We don't want to go back in our gender boxes," she was conveying this message. In other words, we don't want to face a challenge to our gender identity and not the struggle to overcome gender dysphoria, but this is a point I will reserve for later. Keep this in mind as you listen to Joshua Safer and Marcy Bauer's attempt to resolve their tensions.
But how do you, there's not really a good...
So far, they can't keep their story straight.
5 or 6 years old. There are people that come out at puberty and later decide their gender identity is different. I mean, that's a very difficult argument to win.
So I would say that this is why we want this to be the domain of the medical system. And I don't want to get too hung up on therapy, not therapy. It's just having the people who know what they're talking about on the professional side being engaged in the conversation.
Anyway, the new standards are going to reflect greater self-autonomy and less gatekeeping, which is an argument we would get from the left, which would say that, it should be, surgery on demand, hormones on demand. I should be able to go into a vending machine and get estrogens or testosterone. There's nothing wrong with me mentally.
I wonder if I'll have to start dispensing hormones to kids.
As it's not now. Versus people that say, oh no, you need to go through these hoops, you need to see therapists, you need letters, which is the traditional method of how we've done things.
A kid, same circumstance, comes in age 14, just walks into their pediatrician. They're not going to quite have it so casual. There's going to be a mental health component working through, so an extra pair of eyes at least, beyond a pediatrician, working through what that kid is planning.
Maybe they're talking about Cyclops monster jawbreakers. They look like eyes, also popular this year.
There's a debate about mandatory therapy, for example, for young people, isn't there?
Historically, there was a mandatory therapy that will shift to more how I'm framing it, which is a mandatory extra pair of eyes, a mental health assessment, not therapy.
Hey guys, it's time for a presentation. Take it away, Truther.
Joshua avoids talking about therapy as necessary when evaluating adolescent patients who say they identify as a gender other than their natal sex, even says therapy is not a required component by playing word games. Marcy Bowers said that in the beginning of the presentation, gender identity is immutable or mostly immutable, so the definition of immutable is not capable of or susceptible to change. Then after that, Marcy makes a statement that there's not really a good way to prove that gender identity is established at 4 or 5 or 6 years old. In other words, gender is non-testable. She goes on to say, there are people that come out at puberty and later decide their gender identity is different. Merci said also a little later, gender identity is a very difficult argument. Gender identity can change, sometimes changes later in life. So in her statement, Marcy Bowers undermines her own arguments. Before we continue, let us clarify some terminology, including the meaning of belief. 1. A mental attitude or habit in which trust or confidence is placed in someone or something. How about science? Science is a process of investigation. This methodology is used by scientists. However, there are several types of scientific evidence to evaluate, particularly those relevant to health and pharmaceutical claims. First, let's start with case reports. A case report is a detailed description of a particular patient or group of patients. They are often used to describe unusual or rare cases and can provide valuable insights into the natural history of a disease or the effectiveness of a treatment. However, case reports are considered to be the weakest form of evidence, as they are based on a small number of patients and may not be generalizable to the larger population. Next, we have case control studies. In a case control study, researchers compare a group of patients with a specific disease or condition, the cases, to a group of people without the disease, the controls. They then look for differences between the two groups in terms of risk factors or exposures. Case control studies are useful for identifying potential risk factors for a disease, but they cannot establish causality. Cohort studies are similar to case control studies, but they follow a group of people over time. Researchers will often follow a group of people who have been exposed to a certain risk factor and compare them to a group of people who have not been exposed. This type of study is useful for identifying the long-term effects of an exposure or risk factor and can help establish causality. Randomized control trials are considered to be the strongest form of evidence in medical research. In an RCT, a group of patients are randomly assigned to receive a specific treatment or a control group. Researchers then compare the outcomes of the two groups to see if the treatment is effective. RCTs are considered to be the gold standard in medical research because the randomization helps to control for other factors that may influence the results. Finally, we have systematic reviews. A systematic review is a comprehensive summary of all the available evidence on a particular topic. Researchers will search for and analyze all relevant studies, including RCTs, cohort studies, and case control studies, to get an overall picture of the state of the evidence. Systematic reviews provide a comprehensive and unbiased view of the current state of knowledge on a topic, but they are limited by the quality and quantity of the studies included. In terms of resources, case reports are the least resource-intensive, while RCTs typically require the most resources, such as funding and personnel. Each type of study has its own strengths and weaknesses, and the choice of study design will depend on the research question and the resources available. In summary, case reports are the weakest form of evidence, while RCTs are considered to be the strongest. Case control studies and cohort studies are useful for identifying potential risk factors and long-term effects, while systematic reviews provide a comprehensive overview of the current state of knowledge on a topic. Each type of study requires different resources, and the choice of study design will depend on the research question and the resources available. Gender identity stands at the following level according to Joshua Safer and Marcy Bowers. Anecdotal and expert opinions. Anecdotal evidence is a person's own personal experience or view, not necessarily representative of typical experiences. The above chart does not even rank anecdotal evidence. Keeping this in mind is crucial because faith in something is what drives things. So, how do we get here? There are different approaches that have been developed to address individuals with gender dysphoria. The traditional approach popularized by Ken Zucker, the so-called living in your own skin model, and the gender-affirmative model, which was popularized by Diane Ehrensaft, emphasizes the importance of supporting individuals to explore and express their so-called inner gender identity. Also the middle way, the watchful waiting approach, which encourages individuals to take their time in exploring and understanding their gender dysphoria. Let's now turn to Jack Turban, who will give us a presentation on his take on gender identity research.
Two main approaches have been described for prepubertal children. The first was popularized by Ken Zucker. He chaired the DSM-5 committee for the gender dysphoria diagnosis, was at University of Toronto, but is now in private practice. And he described what's called the living in your own skin model. So this involved psychotherapeutic approaches to try and promote identification with one sex assigned at birth. Many would call this conversion therapy or conversion efforts. It's important to say that most major medical organizations have now labeled this an unethical approach, and it is illegal in many US states. But the ideas are still around, so I think it's important to talk about them. So this would involve things like if a young birth assigned male says that they are female, you would kind of have the kid play more with other boys and limit play dates with girls, spend more time with dad, less time with mom, take away the dolls, give more trucks, take the kid out of gymnastics, put the kid into baseball, things like that.
I don't try to change anybody's gender identity, but what I'm interested in when it makes sense with an individual child / adolescent and family is what's the best way to reduce gender dysphoria.
Okay.
And the rationale for this were some studies that suggested that 80% of prepubertal gender diverse children, if you follow them up in adolescence and adulthood, again, 80% of them would actually identify as cisgender. And so the logic here was that maybe you can hasten their re-identification with their sex assigned at birth to prevent future medical interventions that they would need, hormone surgeries, et cetera. I think what was kind of unspoken in this approach was really there was a desire to prevent kids from growing up to be transgender because they faced so much stigma in adulthood and hoping that they would have an easier life.
Yo, this reminds me of my college days, man. Me and my roomies used to knock back a cold one called Dead Namer before heading out to a wild showing of the Rocky Horror Picture Show. The Dead Namer was a righteous pina colada made with vodka, coconut juice, and Ambien, with a sprinkling of glitter, and we always let out a raucous kerfuffle 3 times before chugging it down. But after that show, let's just say we ended up in the old emergency room. This drink caused some intermediate blackouts, and some people didn't wake up. I still miss Charlie and Philip.
And data, but that is the first approach, generally not practiced in the US and illegal in many US states. On the opposite end of the spectrum is the gender affirmative model. So this was popularized by Diane Ehrensaft at UCSF. And what she said was, number one, I don't buy this data that 80% of kids change their mind. And if we have time at the end, folks can ask questions about that data. It's very complicated, but I think the most important thing about that data is they didn't start with kids who actually said, I am a gender different from my sex assigned at birth. They just looked at kids who were referred to gender clinics. So a lot of those kids may have just been like tomboys who were cisgender or cisgender boys who liked playing with dolls. And because they weren't transgender to begin with, it's maybe not surprising that they didn't identify as transgender later in life. But even if it were true that many of those kids are going to later identify as cisgender, Diane Ehrensaft pointed out that it's just really dangerous to try and force kids to identify as their sex assigned at birth.
Okay, so the question is, what about the kids between 1 and 2 who are just developing language or may not even have it yet? They're very action-oriented. So, and at that time, this is where mirroring is really important and listening to actions. So let me give you an example. I have a colleague who's transgender, and there is a video of him as a toddler. So he was assigned female at birth. There is a video of him as a toddler tearing barrettes out of then her hair and throwing them on the ground and sobbing. That's a gender message. And when it happens not just once or twice or 3 times, that's a gender message. Sometimes kids between the age of 1 and 2 with beginning language will say, I boy, when you say girl. Those 2 words, I boy. That's not a pre-verbal, but an early verbal message. And sometimes there's a tendency to say, well, honey, no, you're a girl because little girls have vaginas and you have a vagina, so you're a girl. And then when they get a little older, you'll hear them say, did you not listen to me? I said, I am a boy with a vagina. Okay, but they can't say that between 1 and 2.
To try and force kids to identify as their sex assigned at birth. And that this could promote shame for the kids, especially the kids who grow up to be transgender, could damage relationships between the parents and the kids, damage relationships between the therapist and the kids. And that the idea that, and then in addition, she also said that if a young child wants to socially transition, so change their name, change their pronouns, change their haircut, dress, etc., that you should just let them. And the worst case scenario is that they will later change their mind and go back to wearing pants or go back to wearing a dress, and that there's nothing about that that's inherently dangerous. Whereas on the flip side, telling them that they can't may promote shame and stigma that likely drives the high rates of anxiety and depression that we see in these kids. So the first debate is it appropriate or advisable to implement psychotherapeutic interventions to push transgender or gender diverse children to identify with their sex assigned at birth? For shorthand, we can call that conversion therapy or conversion efforts, yes or no. And then the second question is an early social transition advisable? So whether or not you're kind of doing these interventions to try and get kids to identify with their sex assigned at birth, do you advise that parents have their children change their names, pronouns, dress, etc.? The first controversy is this early social transition. So for this young prepubertal child who identifies as female, different from their sex assigned at birth, do we tell the parents, don't let this child socially transition, or go ahead and
Barbie doll or not? That's what you get from someone who received their medical degree from a toy store.
Studies from the 3 different clinics we just talked about. So if you look at this graph, going from left to right, that's increasing anxiety and depression, they're internalizing scores. Green is the normal range, orange is the preclinical range, red is the clinical range. And there was a cohort of kids who socially transitioned in the US, prepubertal, who were followed up after, and their mean anxiety and depression scores were 53. Not very different from cisgender controls or the general population. And then there were these 2 cohorts, one from Toronto, where they do no social transition, one from Amsterdam, where they also recommend no social transition. And you can see that their mean scores were in the preclinical range.
Yeah.
3 main approaches have been described for prepubertal children.
Not therapy. There might not be any need for therapy per se.
Are you worried?
And that scares people.
Yeah, that scares people. Like, okay, so I'm like, okay, I think there are a lot of well-meaning people who worry about young people who are making.
I was sold on this gender stuff from the first therapy, no therapy statement.
This is buying time for this individual, but they think this young person, adolescence is really hard and complicated. They're searching for belonging. The pandemic has only exacerbated feelings of loneliness and isolation. They're looking for identity. We all are, right, at some point, and community.
What else might be going on with these adolescents? While Joshua and Marcy Bowers, as well other affirmative model evangelists, focus solely on gender identity, there are numerous psychiatric issues that impact youth. The first is borderline personality disorder, while the second is autism. Here's an explanation from a well-known YouTube psychiatrist.
So let's talk a little bit about borderline personality disorder today. So borderline personality disorder, if I want this person to like me, what I'm going to do is I'm going to pretend to be into the stuff that they're into. Right? So if this person is into metal bands, I'm going to pretend to like, oh, I love metal too. So you kind of become this chameleon in life where you don't have your own joys, preferences, desires. You kind of adapt and absorb the desires of other people. We also see self-harm behaviors, which I think are really interesting because self-harm behaviors aren't always suicidal in nature. This is something that a lot of people don't understand. Self-injurious behavior and suicidal ideation are not always the same thing. Suicidal ideation is when I want to kill myself and end my life, which, by the way, people at BPD are very high risk of. So that's a very real risk. But the self-injurious behavior doesn't necessarily correlate with that. When I've worked with patients who have BPD, when I ask them, why do you cut or why do you burn or why do you do self-injurious behavior, what I tend to find is that it's almost a meditative practice for them. I'm not advocating for doing that. But if you ask them, okay, when do you cut? Well, I cut when I feel emotionally really, when the pain gets so intense on the inside and I'm so unloved. If I start cutting, that pain, the pain of the physical sensation of the cut actually knocks the emotional pain and the fear of loneliness and abandonment out of my mind. It's a very intense focusing technique. There's a new paper that just came out that's a meta-analysis looking at the relationship between autism spectrum disorder and gender identity issues. And I really, really love this paper because it illustrates a lot of really cool things. So what they did is they took 41 different studies looking at the link between autism spectrum disorder and gender identity disorder. And they essentially amalgamated all of that data. If we take, let's say, 100 people with autism spectrum disorder, what do we find? And what they found is that if you have autism spectrum disorder, you're 4 times as likely to endorse gender dysphoria or gender identity issues. So that means that people with autism are 400% more likely to have issues around gender variance. So they also found that 15% of people with autism spectrum disorder actually report being non-binary. So that's a staggering amount, okay? So people with autism spectrum disorder have difficulty mentalizing. And mentalizing doesn't just have to do with external people, it also has to do with internal thoughts. So people with autism spectrum disorder have difficulty understanding their internal environment and how it shapes their actions. So this is what leads to a lot of things like social difficulties because they're not really aware of sometimes what they're feeling or experiencing on the inside, especially when we're talking about gender identity variance. So there are certain physical features that I have that may make me a man, but my sense of being a man is sort of determined somewhat internally. There's an external component and there's an internal component. And if we have people who struggle to understand their internal state, it sort of makes sense that they would struggle to understand what their gender identity is, because a lot of that comes from actually the inside.
Remember what Jack Turban said regarding gender identity.
It's very complicated, but I think the most important thing about that data is they didn't start with kids who actually said, I am a gender different from my sex assigned at birth. They just looked at kids who were referred to gender clinics. So a lot of those kids may have just been like tomboys who were cisgender or cisgender boys who liked playing with dolls.
The adolescent or the adult merely has to say the magic abracadabra words, I think I may be transgendered, and all other diagnoses are simply forgotten because they are classified as transphobic.
They may not have the, they may be going through the difficulties of adolescence, and they may be making a decision about their gender identity that they are not equipped to make. And perhaps the medical establishment needs to be more careful and more conservative and make sure they do go through therapy before they are making such a big decision for themselves. And I'm curious how you would assuage some of the concerns that I think perhaps well-meaning, well-intentioned people have.
You know, this is the quintessential question for this group. There's a doubt because people have their own kids. I have 3 kids. You know, they want to be firemen or fairy princesses or all sorts of things, and they change their mind and they end up being engineers or whatever. Kids change their mind about a lot of things, but one thing that is established very, very early and is almost immutable is the idea of gender identity. And you get that.
My kids wanted to grow up to be arcade machines, and look where they would have ended up.
Is to give a person time. Blockers are safe. They are reversible for the most part. And that's the idea, is that you can block puberty before you get the secondary sex changes like a beard or a voice deepening.
Hey guys, it's time for a presentation. Take it away, Truther.
Joshua and Marcy Bowers keep pushing puberty blockers as some sort of pause to help the child decide if they want to be a boy or a girl. Putting aside the claim that one can actually change sex, it's important to consider the potential risks associated with employing puberty blockers, originally designed to treat prostate cancer to prevent adolescents from the wrong kind of puberty. Moreover, we shall analyze the ideology that informs their assertions. My condition and why I know so much about puberty blockers. So I have something called congenital hypogonadism, or sometimes referred to as hypogonadotropic hypogonadism, which is a type of disease that affects the pituitary gland. Let's look at a presentation by Jack Turban. He will go over the basics of puberty and how the pituitary gland starts puberty.
So just for a little bit of review, so this is looking at GnRH, gonadotropin-releasing hormone, which is released by the hypothalamus. And before puberty, we release very low levels of it. In early to mid-puberty, we start to have intermittent spurts of it. And then in mid to late puberty, you have this nice sinusoidal release of GnRH. And it's that sinusoidal release that you need to stimulate the pituitary to make FSH and LH, which ultimately causes the gonads to secrete estrogen or testosterone. And it's that HPA axis activity that you need to start puberty.
As Jack said, it affects the sinusoidal release of these hormones. Now, what he said, FSH and LH are the things that your pituitary gland produces to stimulate the testicles or the ovaries to produce either androgen or estrogen, depending on if you're male or female. This is not gender, this is biological sex. This is evolutionary. It's probably 100 million years old of evolution has gone into this process. And what puberty blockers do is they essentially instill that into your child.
There are these medications called gonadotropin-releasing hormone agonists that keep the level of GnRH tonically high. So when it's tonically high, you lose this sinusoidal release, and that shuts down the whole axis.
We actually give a promoting mechanism, right? We are actually giving gonadotropin-releasing hormone analog, which promotes this whole system, which doesn't seem to make a lot of sense, except that it does, because we kind of overwhelm the whole system, really. We fry those receptors and cause downregulation at some point. So very, very effective.
So they give your child my disease, my underlying disease.
And so we're going to treat that by either helping to fix the pituitary or having them get hormones of their actual sex. Next slide, please. Okay. Are there any medications which can cause this condition? There are. Has anyone heard of Lupron before?
What I have to do is, since I don't make any of that, since my LH and FH never started, I have to basically substitute my androgen with, right now, the current medication I'm taking is what is called Xiostid. Here it is. It's 100 milligrams. Feel just like an EpiPen. It's quite convenient compared to stabbing your muscle, which I had to do for about, 20 years. I had to stab my muscle with that oily stuff. And a horrible, which is called the androgel, which goes and soaks through the skin. The problem with that is it gets all over everything. The other thing what this does is this only delivers to androgen, which affects all my muscles and everything except my reproduction system. My reproductive system stays dormant during this time. Because my testicles were never stimulated, they never produced sperm or androgen and hence did not expand because the majority of the testicle size is primarily connected to spermatogenesis. Puberty blockers prevent fertility by preventing the FH, and therefore testicles stay very small like a baby's, and everything else develops except for those testicles. We're going to look at a video of Dr. Tandy at the Gender Clinic at Stanford University. I went to the Stanford Clinic for Adult Endocrinology after I aged out of pediatric endocrinology to treat my condition, and I got seen by the head of the entire clinic, the endocrinology clinic, which gender clinics are under. Dr. Tandy is going to talk about somebody called Avery, who has been labeled as a trans child. The only difference between Avery and me is Avery is getting estrogen, and Avery has also gone through some puberty as a child. So Avery is actually a little bit more developed than I was, but the puberty blockers cause, as I said earlier, the same underlying condition that I have. Let Dr. Tandy introduce herself.
Hi, my name is Dr. Tandy Aye, and I practice endocrinology, and I'm the medical director of the Gender Clinic at Stanford Children's Health. I'm a kid's hormone doctor, and hormones affect your entire body.
So Dr. Tandy is the same type of physician I would see for my hypogonadotropic hypogonadism. Now listen to Dr. Tandy in a TED Talk a few years back as she introduced this so-called trans child.
Her mom sensed a special bond, a mother's intuition, that Avery was different. And her parents, as soon as Avery was a preschooler, knew that as a daughter with a penis, they needed to advocate for her rights and that they would allow her to live in her affirmed gender. Start gender affirmation therapy, which is the use of medicines and possibly surgery later on to physically align someone with the gender in which they identify. However, if as soon as pubertal blockers were added, and then estrogen was added to her therapy, Avery's testes never developed.
So right off the bat, we have words like intuition and her daughter was different and special. These are statements of faith. That is true, her testes never developed. Just like mine, they are frozen in time because they never received the LH and the FH hormones that activate the sperm and androgen. Next, she says,
in fact, she does not make any sperm. And her reproductive capability to be a biological parent has been eliminated. Her testes are non-functional. And in medicine, don't we often recommend the removal of non-functional organs, like an appendix?
Dr. Tandy is an endocrinologist, and she's making a false statement. Avery testicles are dormant because they haven't been stimulated. Then Dr. Tandy makes her point that she is trying to convey.
Therefore, does it make sense for Avery to wait until she's 18? Or should older adolescents be allowed to have surgery before the age of 18?
Compare this to Dr. Turban's claim that puberty blockers do not cause infertility. He is also deceitful because blockers cause infertility, but not sterilization as long as the testicles are retained. Of course, removing them renders the child sterile. Dr. Turban is confusing infertility with sterility. Let me define these terms. Infertility is extremely common, and once the reason for the infertility is diagnosed and treated, most formerly infertile couples do in fact conceive successfully. Men and women alike can be the source of infertility, with a variety of different causes. Sterility is totally different. A person who is clinically sterile is unable to conceive, whether through medical or surgical intervention, or through assisted reproductive technologies. Anyone who has my condition or is placed on puberty blockers requires fertility treatment. Let me walk you through the measures I took to reclaim my fertility, despite the fact that I was 40 years old at the time, and my testicles had remained dormant since birth. Unlike what you have heard, they stay dormant. Now, how do you activate those? At the age 40, I wanted to activate my reproductive system, which is not a good idea. You have to start around 20 to make it really effective. But then I would take something like this. If you can see that, it's actually HGC. It's a type of hormone that pregnant women, when they get pregnant, they detect it in your urine. That's how they know you're pregnant. That's how pregnancy tests work. And what this does, it's very close to the LH, and it actually starts activating my reproductive. Therefore, my testicles start to grow, and they start to produce sperm. Now, the other thing, if I wanted to actually produce enough sperm, I have to use something called this. So this is a cartridge. This is about $250 a pop for one dose, and it takes many years. Remember the FH that puberty blockers prevent the pituitary gland from producing. This is essentially the same hormone causing spermiogenesis. So the whole process is around, can cost up to $20,000 just in medication. They come in pins like this. So this is if I wanted to actually have children, and then they'd probably have to end up either going in there and fishing some sperm out or doing something else. So this is a very complicated process. I have marks all over my stomach. I have bruises all over because when you inject things, it's liquid and it breaks the blood vessels. When hormones go up and down, you get all sorts of these types of diseases. And with all this hormones, this is about $750 a month my insurance pays. So all in all, together with my rheumatoid arthritis, I would say my insurance pays around $35,000 a year. So I'm a permanent medical patient. So let's watch this presentation on the side effects of my condition, as well as people who are currently on blockers.
Growth of their organs, as I said, they're going to develop sexual dysfunction because the organs never developed correctly. They're going to prevent sperm production, as I said, and disrupt normal brain and bone development.
So the doctor went over the standard side effects of untreated hypogonadism. If it goes untreated, unlike my condition, which I actually got treatment for. So if I didn't go through treatment, I would have had a lot of those side effects. Mother Nature has the answer. With the onset of puberty, the female pelvis expands. With the onset of menopause, it contracts again. In contrast, the male pelvis remains on the same developmental trajectory throughout a lifetime. The striking results of a study by the University of Zurich suggest that the morphology of the female pelvis is influenced by hormonal changes in puberty and during menopause.
For females, at a young age, they'll actually acquire a menopause-like state because they're not getting proper hormones. It will block normal breast development. They'll also have sexual dysfunction. You'll also cause infertility, as I said, and affect bone and brain development.
In her lawsuit letter to the gender-affirming physicians that treat her, Chloe Cole highlights the negative effect of puberty blockers possibly affecting her pelvic bone.
If you put a young girl on puberty blockers at the onset of
At 24, your child is going to say, this was a mistake. And we just talked it through. What is testosterone going to do for the next 5 years? And your child's going to have a lower voice, and it's going to have maybe a little bit of facial hair here, and you're going to have a little cosmetic conversation that you're going to have. And I think that's about it. And the fertility not affected, and
puberty, like the first pubic hair. Her ovaries aren't going to develop. She will be sterilized if she goes on to testosterone, and
she will be 100%.
Yes, that's 100%. Okay. If the ovaries never develop, then they can't.
They can't.
Now, if she's on puberty blockers for 2 years and testosterone for 2 more years, and then she detransitions, that's we don't know. Clitoral enlargement is another thing that happens to everybody. It happens to varying degrees. I have met multiple people for whom that caused pain, for whom that caused chronic pain, because kind of like where the vocal cords are thickening in a larynx that's not enlarging. And so now it's all crowded in there. The same thing can happen with the clitoris. So the clitoral enlargement is not reversible.
As you can see, puberty blockers have severe side effects that interfere with the maturation of boys' and girls' bodies and minds. Now we'll look at the broad scope of transactivism and the fictitious reality promoted by their advocates. Let's go back to 2013, when Jennings and trans politics captured the nation's attention. It began with daytime talk shows, and then proceeded to infuse common discourse with misinformation, one of which was that puberty blockers combined with cross-sex hormones will cause a child to undergo opposite-sex puberty, and you didn't need surgeries. So this was actually a belief that the gender faith advocates had for quite some time. They no longer talk about that because the belief cannot be maintained with the current evidence. Here is Mr. Cher's trans son who will talk about this with Jennings on a show.
Oh my God. Crazy. Yeah.
That there would be parents who were astute enough to understand that this was not just a little boy who thought about being a girl who actually was a girl.
Yeah, I didn't even feel like I could talk about it. So, and I didn't even know that I could grow up and become a man. I didn't even know, such things were possible. So, and nowadays, and especially with the hormone blockers, these kids that are figuring this out young, parents that are supporting them, are not going to have to go through the surgeries and the procedures and everything that we had to go through to try to reverse what, biology did to us. So,
Exactly.
yeah.
So I could get my Twitter account pulled because that was considered hate speech. Saw that as gospel truth, that you could actually simply block people's puberty, give them the opposite sex hormones, and they won't need all these surgeries. In order to have a medically induced puberty like I do, you don't go into the endocrinologist and they just don't give you a large amount of androgen and just saying, okay, go home now and just inject this into you. It's a gradual process of introducing androgen within my system. Even though I was checked out for all the chromosomes and making sure I had no problem, they still wanted to make sure how I respond to androgen. So they gave me a little bit, and then they see what happens. And then they give you a little bit more, and then they see what happens. And then gradually they start going down what is called masculine checklist. So they give you a little bit more, and you should develop to a certain stage. And you develop here, and then if you hit that stage, then they give you a little bit more, and then they increase the dosage and so forth until you go through all the steps or marks of puberty. And then you've basically gone through puberty. Since I had a medically induced puberty, it was extremely different. Again, I wrote that before puberty, I did not know what a gender was. I didn't even understand what the opposite sex. I understand opposite sex, but I didn't know what it was like to be the opposite sex until I went through puberty. Because the opposite sex is a maturation between your sexual organs and your brain, and these maturate through puberty, and you come out the other side being a male or a female, whether or not you're gay or straight. This is how this system's supposed to work. If you interrupt that system, then you end up with some other result. You don't just walk into and you just don't get a giant dose of androgen. Now, I heard a lot of detransitioners talk about just walking into Planned Parenthood and getting 1,000 milligrams of testosterone, which is absolutely insane. And I suspect if you block a girl's puberty, like Cole stated in her lawsuit letter, if you block a girl's puberty at age 12 and then you give them a massive dose of androgen, that may freeze their bones in place, because that's what they would have done with me. If they gave me a really strong dose of androgen, I would have possibly frozen my bones would possibly frozen state, because there's a point of you stop growing, which the cells will stop maturing. Otherwise, they just grow forever. So they stop at a certain point. So it's important for the physician to make sure that the stimulation, which are the sex hormones, match the development of the patient. And these need to be matched when you go through a medically induced puberty, because these are sex-based hormones. Don't let anybody tell you that they're not. They were developed specifically to treat conditions like mine, Klinefelter's, and other conditions. They weren't just simply developed randomly. Now, they were horrendously abused by the pharmaceutical industries, but the pharmaceutical industries figure out how to abuse all sorts of drugs. So next we're going to go back and we're going to look at Marcy Bowers again.
And let's say a transgender girl, so male to female, comes in and says, and everything is fairly well established and stable, looking potentially for hormones even when they're coming to me now. This is even beyond puberty blockers. And I'll ask about fertility plans, like has there been sperm banking? Is there any thought of that? And the kid will say, oh, for sure not. I'm not having kids. And the parent will say, will interrupt and will say, oh yes, we'll be doing sperm banking. I'll make the appointment, honey, and we'll be back in a month, doctor.
So why was Marcy Bowers shaking her head right there? You see her shake her head? She's shaking her head because there's a contradiction in gender-affirming care that she keeps bringing up. The contradiction is Tanner stages 3 or 4 that a male becomes fertile, and the fact that when a male becomes fertile, their secondary sex characteristics basically develop. So they have facial hair, they have all the things that trans women fear they have at the stage when they can go down to the sperm bank and actually masturbate in a little cup and deliver sperm. So she is trying to get them to stop using puberty blockers. When she talks about puberty blockers, look what she says here.
And that's the idea, is that you can block puberty before you get the secondary sex changes like a beard or a voice deepening, and while the child decides if that is really a path they want to go down.
And then after that, here are some activists talking about that it's too late if you hit 14.
I have a child who is 11, almost 12, who has gone through a social transition, and it just all kind of started like about a year ago, and who is really pushing for puberty blockers. As that's the biggest problem, is that by the time everybody goes through those hoops, they're like 14. And it's kind of like you're past the point of blockers. Now we're talking about cross-sex hormones.
Here's Jack Turban saying the puberty blockers, even though puberty blockers cause infertility, saying the puberty blockers don't cause infertility. And then you heard about and then I just showed you about the TED Talk about removing the testicles because they don't need them anymore.
And so it gets at, it does get, that's a very different conversation than at the adult level. And so I'm open to that. I don't think that's a bad thing that just happened in my office. Right. And that a little bit of that voice of reason and a little bit of that conservative ingredient.
This is what they're afraid of. They're afraid of Munchausen's by proxy, where parents are actually living through their children. They're afraid of the kids being swept up by their peers. So like this, or recruiting or social
pressure,
and to join or be inclusive. And that's something that we, have to, in WPATH, we have to put that in. But again, it gets back to that issue of what we want is not gatekeeping. We just want time and very reasoned and well-informed decision-making.
But given the fact that our notion of gender has expanded so much, and I think, when I did the documentary, I think there were like 45 different descriptions for gender on Facebook or something like that. How do you know, for example, if someone is gender nonconforming, right, versus transgender? And and because when you introduce a medical intervention, right, even if it is to buy time, it is a medical intervention, right?
I worry about the AAP because the Endocrine Society put out guidelines in 2017, and they were very careful in the guidelines. One, to point out that the evidence was of low and very low quality. And they also said in the guidelines,
we're responsible with the Endocrine Board for writing guidelines of care for endocrinology.
The Endocrine Society, yes.
The Endocrine Society,
yeah.
That they have no idea how you identify which kids are trans and require this treatment. So they were sort of like, we're just technicians and we'll just tell you, like, if you have a trans kid, we'll tell you how to do the transition.
And it is a medical intervention, right? So how do you make that determination?
So I want to come back to, I'm not in, well, the quick answer to the question itself is, I don't need to make a determination across all of that granularity. I really am just trying to decide if the person requires a medical intervention or not. And so in that sense, it's a little bit more simplistic. And the kids who come to see me, the older teenagers, that is, or the young adults, I'm calling them all kids, are label themselves in myriad ways and more ways than they used to. But at the end of the day, my interventions are still somewhat simplistic. I've got hormones or not hormones, or surgeries subsequently. I want to say one other thing, though, because we were talking about puberty blockers, and I want it to be clear that puberty blockers are a conservative small c intervention, certainly for a year or two. And so the idea,
Joshua stated that puberty blockers, such as Lupron, are a minor medical intervention. However, in the above tweet by a transgendered person says that they have been taking Lupron for 16 years. This is highlighted in a 60-minute segment where Chaz explains that when transitioning off blockers, surgery is required.
Her arm that stops her body from going through male puberty.
If I get the surgery, then, my testicles will be removed and I won't produce any more testosterone. So therefore, I won't need to get any more blockers.
This should be kept in mind when discussing going on a medical treadmill, a point that Marcy is about to make.
Really important for people to recognize that's a safe place to go when more deliberation is required.
But they feel like once you're on the treadmill, you're unlikely to want to get off. Once you socially transition, you're unlikely to want to get off. And how do you safeguard?
I hear that fear, but I don't actually think that's what we're seeing. I think we're being very conscientious about who we bring into care. And so it's really true. Most of the kids who are getting on puberty blockers go on to subsequent treatment.
And Norman Spack, who was at Boston Children's, who started the idea of puberty blockade before they went through later stages of puberty, using puberty blockers. He used to say, though, that the way to really determine whether somebody was a candidate for puberty blockers is if they found the prospects of puberty itself, the physical changes of puberty, extremely dysphoric.
Although I'm not even going there. I know people used to say that. Some people still say that. I don't actually even say that.
You don't even say that?
No.
Well, what is the trigger to go on blockers then? What do you say? How do you?
Somebody who is.
Wait a minute. What did I hear Admiral Rachel Levine say?
The positive value of gender-affirming care for youth and adults is not in scientific or medical dispute.
Evidently, there is a dispute here.
And puberty that does not align with their gender identity, in all its complexity, who needs time to think about what it is they really are imagining, what they're thinking they're going to do, that person's a candidate for puberty blockers.
Hey guys, it's time for a presentation. Take it away, Truther.
Now I'm going to try to separate gender identity with gender dysphoria, which are these two. One's a clinical diagnosis, and the other's faith, and these have been intertwined and have been glued together by this treatment called gender-affirming care. Josh Marcy and Jack Turban are major proponents of gender-affirming care. Both Joshua and Jack Turban are sure that a child that just expresses a transgender identity is a transgender child. But where did they obtain their underlying evidence? As Jack previously stated, their primary source of proof is the Dutch study. What about the Dutch study? What questions can be raised regarding its legitimacy? Let us go to a court hearing in Florida over gender-affirming care, which was provoked by the Dutch and other Scandinavian countries discontinuing the use of puberty blockers.
The Dutch protocol was deemed a success because the youth continued to function well after surgery. This affirmative model of care has spread wildly in the last 8 years. The Dutch protocol is the foundation youth transition was built on. It is flawed. It is based on weak evidence. These are some of the problems with the Dutch study. Many concerns have been raised about its methodology. It was a case series, a small cohort of 55 teenagers. There was no control group. The follow-up period was only 18 months. This short period should be of concern. And most importantly, there has been no long-term data reported on these 55. The Dutch have been asked for their long-term data. In a June New York Times article, Dr. De Vries, the lead author, said the Dutch has lost contact with 50% of their early cohort. Dr. De Vries was interviewed on an American podcast in January. She made it clear that their patients' lives are much more complicated than the original study's outcome suggests. The Dutch, to their credit, were concerned about false transitions. Transitions that would later be regretted. False transitions would be the worst possible outcome. Today, we call that regret and detransition. The Dutch had inclusion and exclusion criteria, hoping to limit false transitions. I want to emphasize two of these criteria. Early onset gender dysphoria was a requirement for transition. Early onset was described by the Dutch in one paper as gender dysphoria, quote, from toddlerhood.
Let's take a look at this excerpt from the WPATH conference that demonstrates the alternative reality that gender-affirmative care operates.
Explore transgender health in a compassionate, sensitive way. Wondering if there's something available for transgender health. Anyone?
There's sort of a conglomeration of various things that people are pulling together, and there are some of us who are working on trying to develop some things like that, but really there's nothing out there that has been well researched and validated and normed and all that kind of stuff. It's pretty hard to do. What we do is use a lot of clinical wisdom on that. And there isn't, the other thing to know is that, we're talking about gender dysphoria and this body alignment and that kind of stuff. We have no tools that can evaluate somebody's identity. We can get their ACEs scores. Sure, we have a tool for that. And often trauma is a big part of people's experience. So we want to look at some of these other factors that are going on. The problem is a lot of those are gender normed. And so trying to figure out how to use those tools has also been really tough. And so, I would say the answer is no.
There have been a few people who have developed translations,
yeah,
I think, and in different scales, but nothing, as you say, Sean, nothing has been normed and agreed by the professions that this is a useful tool.
Yeah, there's a minority stress scale that was developed that's good for the trans community, but it's for adults. So then again, it hasn't been translated for kids. But there are a few things out there that have been used that I think are really good in that frame. So it's very individualized, and it's not actually about how do we assess where somebody needs to go on their gender journey. That's more of a overall treatment planning and health evaluation. So.
And like Sean said, this isn't something that happens overnight, and unfortunately, because of all the politicalization and everything going on, there's sort of this sort of fear thing that's been created, like, oh, somebody's going to read a magazine article and suddenly they're going to say, oh, I'm trans and I need all the surgeries and I need the hormones and and it just doesn't happen that way, especially with younger people. There's always been an extensive recommendation for multi-specialty teams of specialists, working with the family, working with the younger person. This goes on and on and on and on. I mean, these interventions and support are very intensive. And a lot of that just gets lost in this politicalization, really, that unfortunately is now behind sort of some of these questions and things that are out there.
Well, let's take a look at a case from a whistleblower who worked in one of these gender clinics. I am a 42-year-old St. Louis native, a queer woman, and politically to the left of Bernie Sanders. My worldview has deeply shaped my career. I have spent my professional life providing counseling to vulnerable populations, children in foster care, sexual minorities, the poor. I'm now married to a trans man, and together we are raising my 2 biological children from a previous marriage and 3 foster children. We hope to adopt. All that led me to a job in 2018 as a case manager at the Washington University Transgender at St. How little patients understood what they were getting into was illustrated by a call we received at the center in 2020 from a 17-year-old biological female patient who was on testosterone. She said she was bleeding from the vagina. In less than an hour, she had soaked through an extra heavy pad, her jeans, and a towel she had wrapped around her waist. The nurse at the center told her to go to the emergency room right away. We found out later this girl had had intercourse, and because testosterone thins the vaginal tissues, her vaginal canal had ripped open. She had to be sedated and given surgery to repair the damage. She wasn't the only vaginal laceration case we heard about. Other girls were disturbed by the effects of testosterone on their clitoris, which enlarges and grows into what looks like a microphallus or a tiny penis. I counseled one patient whose enlarged clitoris now extended below her vulva, and it chafed and rubbed painfully in her jeans. I advised her to get the kind of compression undergarments worn by biological men who dress to pass as female. At the end of the call, I thought to myself, wow, we hurt this kid.
And I just think, we just need to remember, access to gender-affirming care is suicide prevention, period. We know, we've had this for over 50 years, looking at the studies of youth in Europe, in the United States, gender clinics, as well as adults. that when people have access to gender affirming care, and it doesn't matter what that care looks like, that care can change. Like Sean said, some of these folks may not necessarily persist in their gender journey, but whatever that care looks like, that saves lives. And when people don't have access to care, that's when they're killing themselves. That's when they're participating in behaviors that are dangerous to themselves or harmful to themselves, and all the horrible health disparities that we see linked with gender diverse people.
And there had to be no active mental health issues. Mental health problems excluded a teenager from transition. The very patients the Dutch excluded, late onset, post-pubertal, gender dysphoric youth with comorbid mental health issues are now the majority of youth being transitioned. We are transitioning the very population the Dutch excluded because they feared harm.
To understand what could be happening, let's go back to the 1980s and 1990s, when the satanic panic swept the country and a catch-all diagnosis of multiple personality disorder led an entire generation of parents to believe their children were victims of satanic cult ritual sex abuse. Back in the 1980s and 1990s, there was a widespread fear of underground Satan cults, and that became known as the satanic panic. This led many to believe that a satanic cult was responsible for the abuse of young children. The government estimated that there were 50,000 cults operating in the country. When I was a kid, my mother locked the windows to my room for fear that Satan would come in and kidnap me. There was a constant stream of education about the signs to look for in determining whether or not a child had been abused by demonic entities at the time. Consequently, a great deal of content was published. There were a number of daytime talk shows that discussed the symptoms of abuse and the ritualistic abuse they believed to be occurring. At the time, psychotherapists imagined themselves to have an extraordinary ability to discern who was evil and who was not. They were able to detect hidden bias. They also felt they could persuade children to recall SRA, which stands for Satanist Ritualistic Abuse, allowing these criminals to be convicted. In their mission to construct victims of non-existent crimes, the psychotherapists were joined by sociologists, journalists, and law enforcement. Specialized therapists popped up all over the nation to diagnose these personality disorders, which held the secret to forgotten memories of past satanic abuses. Today's belief in a hidden gender identity phenomena is the closest approach to this that we have, and the fact that hundreds of gender clinics recently to handle an onslaught of new transgender children and adults.
The interviews are upsetting to read because essentially what happened is the therapists unintentionally coerced the children into fabricating stories of abuse.
Richard Beck wasn't even born when the McMartin story first broke in 1984. Fascinated by the panic that spread across the country, he has been researching and writing a book on the case for the last 2 years.
You have interviews that will start off with a therapist asking a child whether they had ever played any naked games. At McMartin, this was a huge topic, was naked games. And the children initially say no. The therapist, though, didn't accept those answers. So then they repeat the question. And then they repeat it again. Eventually, the children realize that their interview is never going to be allowed to end until they start giving the interviewer the kind of answer that she wants to hear.
It was obvious in the interviews that all kinds of techniques were highly suggestible, highly pressuring, and is capable of creating false memories of abuse in children, often permanent memories.
Hey, here's another crazy report about the 1980 satanic ritual abuse panic. From a therapist who was involved around that time, let me read a small excerpt from the article. The child who reported no memories of attending the Presidio immediately followed that statement with a spontaneous recollection of a babysitter who let her fall out of her high chair when she was a baby and showed the therapist the scar. It was as if she were speaking in tongues, revealing her trauma only through unrelated physical scars and associative memories of injury, body trauma, and neglect. She also spoke of skeletons who came to get her at night to try to bring her to hell. Thus, it took her many hours to fall asleep. In the cases left untreated, the long-term sequelae of The ritualistic child abuse included an attempt to encapsulate the trauma through a series of defenses and mental distortions. That is from a 1992 article on child sex abuse linked to occult rituals at the Presidio Army-based Child Development Center in San Francisco Thus, the therapist drew a connection between stereotypical demons. Signals like talking in tongues then leaps to the conclusion of Satanist cult abuse. So it appears that these therapists were pressuring children to believe they had been victimized by a satanic cult. What about convincing children that they were born in the wrong body, such as a female believing she is a boy? Wait a minute, who wrote this article? Diane Arensaf?
I said, I am a boy with a vagina, okay? But they can't say that between 1 and 2.
As you saw, the clinician employs many strategies in order to assist the child in regaining their lost memories. Would ask the child to pretend that the story told by the clinician is what actually occurred, and then they would ask the child a wide range of leading questions to see where the child's imagination takes them. In the end, the therapist will be led to believe that the child is recreating the memory when, in fact, the clinician is the one who has provided the story to the child. When the child just repeats the narrative back to the psychiatrist, the clinician is astounded at how this previously suppressed memory has been awakened. Therefore, the fact that someone could repeat back to them their own closely held beliefs and prejudices was extremely fascinating to them. Before we look at gender identity, we need to look at the underlying gender dysphoria, which is used to justify gender-affirming care. What is the definition of gender dysphoria? In a boy, these signs include making verbal statements that he is or would like to be a girl, cross-dressing in girls' or women's clothing, having a preference for culturally stereotypical feminine toys and activities, emulating females in fantasy play, having a preference for girls as playmates, expressing dislike of his sexual anatomy, and being averse to rough and tumble play and group sports. In a girl, the inverse is observed. Of particular note is the intense aversion to culturally stereotypical girls' clothing and the desire to have her hairstyle look like that of a boy. This is an older definition. You notice that the pronouns they use the appropriate for the sex of a child in question. The assumption here is this is a disorder of gender identity, not a hidden gender identity. This definition doesn't assume an internal gender self, an internal spirit. Where did that come from? We need to turn to the gender-affirming clinicians and medical doctors that first started using this belief. Let's look at this 10-year-old video of Johanna Olson, MD, as describes gender identity.
My name is Dr. Johanna Olson. I'm the medical director for the Center for Trans Youth Health and Development at Children's Hospital Los Angeles. We have the largest trans youth clinic in the world with about 250 active patients and about 50 more that are on the waiting list waiting to get in. What we are talking about are those young people who have a gender identity, their internal sense of maleness, femaleness, neither, both, being different than the gender that they were assigned at birth based on their anatomy.
Joanna is not talking about gender dysphoria, she's talking about gender identity. This is where the confusion fundamentally lies. You have two things going on. One is the distraction of gender dysphoria and the fundamental belief in an internal gender identity, and these two things are combined. Let's look at the definition of gender identity. Gender identity to a person's basic sense of self as male or female. It includes both the awareness that one is male or female and an effective appraisal of such knowledge. In the clinical literature, the term gender dysphoria has been used to characterize a person's sense of discomfort or unease about his or her status as male or female. Based on clinical work with children born with physical asexual conditions, Money et al. Concluded that gender identity typically appears in its nascent form between ages 2 and 3 years. During the past 4 decades, this original clinical observation has been buttressed by normative empirical studies, which have demonstrated that children in this age range, typically by about 36 months, are able to categorize people by sex on the basis of phenotypic social cues such as clothing and hairstyle. According to some researchers, this ability likely precedes the ability to self-categorize oneself as a boy or a girl. John Money was the first to propose gender identity theory. He was the one who originally conceived the concept of a child's latent gender soul, or gender essence. His studies included attempting to change a child's gender identification by surgically modifying their genitalia to match the opposite gender, and then raising them as the opposite sex than their birth gender. This was a miserable failure, but people drew the conclusion that there must be a hidden gender beneath the child somewhere. Research reveals that very young kids recognize their parents' sexual orientation before they realize their own. This is crucial because toddlers learn where to position the two roles based on environmental cues. Let's return to Joanne as she attempts to describe the concept of a transgender child.
This was a young kid who was born with a girl type body, was assigned a female gender, and at the age of 18 months said to their mom, "I a boy." So this is not the first time I've heard of this, and so usually this expression comes very early in life. Little kids with gender identities that are different from their assigned ones have a couple of different ways that they can articulate this. Some kids are incredibly strong about it. They recognize there's a difference between their assigned gender and their internal gender identity, and they can talk about it in that way. I am a boy. I am a girl. And these are the things that I like to do. Stop taking me down the pink aisle at Toys R Us, or I really want to play sports, or something like that. Alternatively, an assigned male, somebody born with male body parts, that kid may say, I'm a girl. I want to wear a girl's bathing suit. I want to wear girls' underwear. I want to play with girls' toys. Trans kids do this in the same way that non-trans kids do this. They just like what they like, and that's what they want to do.
A child will often know that they are transgender from the moment that they have any ability to express themselves, and parents will often tell us this. We have parents who tell us that their kids, they knew from the minute they were born practically, and actions like refusing to get a haircut or standing to urinate, trying to stand to urinate, refusing to stand to urinate, trying on siblings' clothing, playing with the quote opposite gender toys, things like that. There is more and more a group of adolescents that we are seeing that really are coming to the realization that they might be trans or gender diverse a little bit later on in their life. So what we're seeing from them is that they always sort of knew something was maybe off and didn't have the understanding to know that they might be trans or have a different gender identity than the one they had been assigned. So that is a growing population that we are seeing, and that's being recognized as being trans and able to be treated.
Notice the problem. To fix gender identity, you must reorganize the anatomy based on a hazy conception of sex assigned at birth. This was the Dutch protocol, in my opinion, patient zero, and the lessons learned from this study brought forth the medicalization of a hidden gender spirit, creating a marriage between invasive surgeries, powerful medication, and hormones to enlist in the search for the gendered soul. Johanna seems to believe that the child has a hidden gender identity, and her indication of this is if the child complains about being born as the wrong sex. Joanne departs from clinical data and resorts to her internal conviction regarding gender identity. What is the child dissatisfied with? The gender designated at birth, the body he is given, or the role expectations? Extremely ambiguous and veers from psychological symptoms to preaching. Children's memories are susceptible to imagination, the social environment, cultural influences, and suggestion. Professionals in mental health should have recognized this. The knowledge was well established in the academic literature, yet Joanne opted for nonsense. Most individuals believe that gender identity is merely an extension of sexual orientation, because homosexuals and lesbians recall growing up with gender dysphoria, and some straight women also report experiencing it. People who are gay and lesbian often struggled with gender dysphoria as children and young adults. As a natural progression of sexual orientation, this is surprisingly prevalent and may be the root from which gender identity grows. Katie Hertz describes her gender dysphoria as a lesbian girl in development.
I think that if I were growing up right now with the same sort of symptoms, I would be diagnosed with gender dysphoria. Immense distress at puberty, immense distress. Like really did not want to become a woman. That was the source of like real anxiety. But I grew up to be a lesbian, but there's a lot of people like me who just sort of naturally aged out of it. Andrew Sullivan has talked about this. You sort of fit into those categories too. It's a natural human variation. And then oftentimes when you grow up a little bit and it sort of interacts with sexuality in a way that makes sense to you, oh, I'm not a boy, I'm a lesbian. Yeah. When I was a little kid, I peed standing up, not all the time, but sometimes I peed standing up. And I literally thought that if I continued to pee standing up, I would grow a penis.
A mismatch between the child's sexual orientation and birth sex is a lot more realistic explanation for gender dysphoria. We want to be the opposite sex of the people we wish to attract. This is a tested and treatable definition, which focuses on psychotherapy to build role models so that the child can be brought to a place where they can connect their internal senses with their body. Remember what Marcy Bowers said about gender identity.
Almost immutable is the idea of gender identity. And you get that when you read the personal accounts of people who have had trans kids.
She is referring to first-hand testimonials from families and children. I call this a bedrock of faith since it defines the theology of gender identification and accepting the road to gender euphoria, a genderless hypothetical ideal world. Marcy Bowers then says this.
Not really a good way to prove that gender identity is established at 4, 5, or 6 years old. There are people that come out at puberty and later decide their gender identity is different. I mean, that's a very difficult argument to win.
She is claiming that gender identity cannot be falsified. A proposition that is not falsifiable cannot be considered as scientific. Let us now examine how this works in practice. Johanna Olson, who will discuss a transgender child at the WPAS 2017 conference. Although we were not in the room when she questioned this child, I want you to listen to her report and ask yourself if she is a physician who is interested in a child's distress over their body. Is this a doctor seeking to alleviate a child's discomfort regarding their biological sex? Or is this physician promoting a gender identity religion? Has she arrived with the assumption that she must save the child from a mismatch between their external and internal identities?
So this kid comes into my practice, and this is the entire reason why. This was an assigned girl at birth, 8 years old, was completely presenting male. Whatever that means, but short haircut, boys' clothes. When the kid came in, the mom was like, "Oh, we don't know what to do. Please help us." And so we started talking about it. And what was interesting is that some kids come in and they have great clarity and great articulation about their gender. They have not really organized or thought about all these different possibilities. And so at some point, after this kid had told me, the mom had shared this whole history and said, like, when this kid was 3, my kid said, could you, stroll me back up to God so I could come back down as a boy? And the kid was like, I didn't say that, 8 years old. So I was like, I don't think your mom made that up. That's crazy. So anyway, so this kid, at one point I said, so do you think that you're a girl or a boy? And this kid was like, I could just see, like, there's just confusion on the kid's face. Like, I've never really thought about that. And so this kid said, well, I'm a girl because I have this body, right? This is how this kid had learned to talk about their gender, was based on their body. And I said, so do you ever eat Pop-Tarts? And the kid was like, oh, of course. And I said, well, you know how they come in that foil packet? Yes. I said, well, what if there was a strawberry Pop-Tart in a foil packet in a box that said cinnamon Pop-Tarts? Is it a strawberry Pop-Tart or a cinnamon Pop-Tart? Kid's like, duh, it's a strawberry Pop-Tart. And I was like, so, and the kids turned to the mom and said, I think I'm a boy and the girl's covering me up. And the best thing was that the mom was like, I just got up and gave the kid this big hug, and it was an amazing experience.
As evidenced by Jenna's behavior, she so strongly believes in this mismatch of gender and biological sex that she places the child in a difficult position. Similar to the therapist in the Satanic Panic, she has a child submit to her views and repeat the mantra of being a real girl in a boy's body. Johanna is astonished by how this child's understanding that she was born in the wrong body has been awakened. This entire session was founded on Muniz's conception of gender identity, and she continues to make the same errors. Consider a recent instance in Florida, where gender dysphoria is utilized as a smokescreen to conceal the fact that the affirmative care approach relies on faith and practice. Dr. Meredith McNamara will speak to the Florida Board Committee on Medical Standards regarding gender-affirming care.
I emphasize that standard medical care for gender dysphoria does meet generally accepted medical standards, and it is not experimental or investigational. Nothing in the state of Florida's June 2nd report calls into question the solid medical evidence that underlies consensus recommendations of WPATH, the Endocrine Society, the AAP, and many others.
So she cites the Endocrinology Society and WPATH, the two organizations that wrote the affirmation models and standards in treatment. Let us hear from the two main people involved in that, Marcy Bowers, the current president as of the release of this video, and Joshua, who wrote the Endocrine Society Affirmative Care Standards. Dr. McNamara is relying on these norms. I've combined multiple clips together so you can see that gender dysphoria is something that therapists, doctors, and the general public believe is being treated alongside the questionable claim of suicide. In clinical practice, this smokescreen conceals gender identity, belief, and the gender journey.
Are contemplating suicide and self-harm rates.
The guidelines that you wrote, because you were responsible with the Endocrine Board for writing guidelines of care for endocrinology.
The Endocrine Society, yes.
The Endocrine Society.
Yes.
And that was based on research papers, data, the things that you saw intervening with gender-affirming care, which may be just being respectful.
I don't actually even say that.
You don't even say that?
No.
Well, what is the trigger to go on blockers then? What do you say? What do you?
Somebody who is entering puberty, where it's the puberty that does not align with their gender identity, in all its complexity, who needs time to think about what it is they really are imagining, what they're thinking they're going to do, that person's a candidate for puberty blockers. But at the end of the day, my interventions are still somewhat simplistic. I've got hormones or not hormones, or surgeries subsequently. Most of the kids who are getting on puberty blockers go on to subsequent treatment.
Before they move to endocrinologists, because a lot of the times they go to the endocrinologist and these kids are already affirmed by somebody. So who is doing the affirmation of these children is my question.
It's all individualized.
Physicians are supposed to provide diagnosis and make treatment recommendations. Gender-affirming care doctors, on the other hand, serve as counselors rather than physicians, not taking direct responsibility for decisions made in public.
It truly depends on the individual. It does take quite some time for people to move from the initial assessment, the first visit, to any sort of medication, things along those lines. But people are ready for different things at different stages in their life and their journey. That's my
right. But I'm an oncologist. Patients don't come to me requesting desire for chemotherapy, but I recommend chemotherapy because that's what's best for them. So as a physician, if you think that gender-affirming care is best for your patients, why have you not recommended surgery on any of your patients?
Gender-affirming care does not equal surgery.
I understand. There's a continuum. That's another thing that's we need to have some quorum here.
Gender-affirming care is basically holistic medicine with some of the most powerful class of drugs we have. Anti-cancer medications like pubic blockers and Lupron, and plastic surgery, particularly plastic surgery that is elective and experimental. So now we're going to transfer to what the public and YouTube personalities such as Emily Watson and other people, how they perpetuate all of this confusion and keep this whole machine running.
Teens can start puberty blockers anytime after puberty begins, usually 12 or so at the earliest. They help by giving a teenager time to consider what they truly want, or time to get ready for what's coming down the road. Once the teenager is older, current recommendations are 16, but exceptions have been made for as young as 14. If it's a particularly mature teenager.
Emily Watson mentioned something that drives me nuts. They say when the child is old enough, they can make a better decision. But you block their puberty at age 13. So they may be chronologically at age 16, but their mental, emotional, and physical shape stuck where you started the puberty blocker. So you've stopped their growth. And this is how I was. This is how hypogonadic end up stuck without maturing, because as the endocrinologist told me that in order to start maturing, that puberty activates the maturing neurology and physiology.
I want to review what puberty accomplishes. So there's maturation of the gonads, which gives somebody reproductive capacity, maturation of the brain, which is abstract reasoning and executive function in particular, physical growth and secondary sexual characteristics. Testosterone causes voice drop, musculature. We know all this, estrogen, breasts, hourglass shape. But the biggest purpose is probably reproductive capacity.
This makes absolutely perfect sense because people are not born sexually active and fully sexually mature because that would make no sense. They gain that when they go through puberty and gain the sexual function. At that point, able to understand what a man and woman is because you must go through puberty to figure that out. Because there's no such thing as a gender essence wandering around your head at age 12. There is a start of one, but they won't know where they stand until they go through puberty.
The poster on Rebecca's wall reminds me of the 1980s Space Shuttle Challenger disaster. There were concerns raised by engineers about the safety of the O-ring seals on the shuttle's solid rocket boosters, but these concerns were dismissed by management who were under pressure to meet tight launch schedules and maintain a high success rate for the Space Shuttle program. Rebecca needs a countdown for this disaster.
They can decide to go off the blockers and then either experience puberty as the sex that they were assigned at birth. Some choose to do that. Or start taking hormones to essentially experience puberty as the opposite sex. After a year or more on those hormones, they can then decide, so around the age of 18, if they would like to proceed with surgeries. Tough for me to nail down for the main reason that puberty blockers are overwhelmingly safe with little to no known negative side effects. But opponents claim a few things about puberty blockers. The things I saw most often, number one, that they're irreversible, which is untrue. As I mentioned, they are easily reversible. And two, that they may cause a loss of bone density and possibly sterility later in life. It appears to me that the medical consensus is that none of that is true. Puberty blockers do not cause loss of bone density or sterility.
But when you institute puberty blockers at Tanner stage 2, one, you assure that person's never going to be able to reproduce. There's no way to extract sperm or... Now my concern is really with the assigned male trans feminine persons. That's who I mainly deal with in my surgical practice.
When I'm dealing with a transgender child, that kid is going to maybe move to hormones to match gender identity and not go through their natural puberty. And it may be the case that should influence when I want to institute puberty blockers for the transgender child. Nothing to do with the legal side of it here. This is just thinking from a medical perspective, where maybe I want for a transgender girl specifically to institute puberty blockers a little later in puberty, after she has spermatogenesis, after she has, so that after there's some sexual development, and then when she moves on, as she likely will, to hormones to match gender identity, she will have some of that in place.
Chris is an activist who is concerned about the effects of puberty blockers on adolescents. In Boston, Massachusetts, he attended a demonstration at Boston's Children's Hospital. He is an activist who participates in conversations across Canada and the United States and has been assaulted physically and verbally by trans activists. Keep in mind what Marcy stated about the Boston Children's Hospital.
And Norman Spack, who was at Boston Children's, who started the idea of puberty blockade before they went through later stages of puberty, using puberty blockers. He used to say, though, that the way to really determine whether somebody was a candidate for puberty blockers is if they found the prospects of puberty itself, the physical changes of puberty, extremely dysphoric.
Puberty blockers are reversible. It's a pause, but our family member has been trans since 4. Pause because they can get off of them and continue in the regular biological puberty. So it is a pause. They can always get off the blockers, and they don't want to because they're in the wrong body.
You think altering a child's biology, sterilizing them, cutting off the breast tissue is the same thing as being gay?
They're choosing to not have that body.
I have a trans daughter. She just transitioned. She's going to be 20, so she did go through puberty. And I would rather have a trans child than a dead child any day of the week.
Do you know who Marcy Bowers is?
No.
Okay, so Marcy Bowers is the president of the World Professional Association for Transgender Health. Marcy Bowers is a trans woman. Okay. Marcy Bowers did the surgery on Jennings at the age of 17, where they had to cut out some of Jazz's stomach to form his neo vagina.
Whatever Jazz needs to do to have a great vagina. I support that.
Marcy Bowers, the president, admitted that literally none of the boys who went on puberty blockers at Tanner stage 2, which is the beginning stage of puberty when they start puberty blockers.
Biological boys?
Yes.
Or trans boys?
Yeah, boys.
You can't just say boys. Are you saying?
When I talk like science, you know, so boys.
Biological boys? Because when you say trans boys.
It's kind of redundant, isn't it?
No, it's not.
Okay.
That's what this whole argument is.
All right, I'll play along. So biological boys, literally, hold on. So literally none of the biological boys who started on puberty blockers at Tanner stage 2, as adults, none of them have ever had any sexual function. They've never been able to have an orgasm. So do you think, my question is...
That's not true.
This is from Marcy Bowers.
No, it doesn't matter.
The president of WPATH.
I've spoken with men who've had that surgery, and they have orgasms. So...
Men. I'm talking about kids.
I'm talking about trans people who've had the surgery who have orgasms.
When did they have the surgery?
Probably as adults.
So that was Billboard Chris, who I had the pleasure of meeting in San Francisco. He is a person who runs right into the danger, and he's questioning this trans mother of a trans child regarding the serious side effects of puberty blockers and surgery. Now, she is not going to be able to answer him because she is stuck within the prison of belief. And that's why I went over all those signs of belief and how it's a journey and how it's about discovering one's inner self, true soul. And it leads to some sort of, you relieve suffering and you come to this euphoric realization in this religion. It produces all the in-group and out-group and all these specialized words and all those types of specialized titles and identities. These are all underneath the rubric of religion. The secret weapon, the magic weapon of gender identity is puberty blockers. They lock in nothing else I've ever seen. I mean, religion has a lot of tricks, but this is a real trick. Here's the data on that.
Some studies that suggested that 80% of prepubertal gender diverse children, again, 80% of them would actually identify as cisgender. Again, 80% of them would actually identify as cisgender.
Most of the kids who are getting on puberty blockers go on to subsequent treatments.
And Norman Spack, who was at Boston Children's, who started the idea of puberty blockade before they went through later stages of puberty using puberty blockers.
So as you can see, once they get them on the puberty blockers, they're locked in to this belief structure. Their parents are locked into the belief structure. The child has to go along with it. Everything gets locked in, and they're going down this path. We'll see, again, the fearless Chris will attempt to pressure one more time to understand the seriousness of these surgeries and medications, but she will retreat within her belief, just like fanatical people do. She's going to retreat in her belief, and she'd be unable to hear, listen, or even examine any other evidence.
About kids who started on puberty blockers at Tanner stage 2, as adults, none of them have had any sexual function. Do you think a 12-year-old can consent to giving away their permanent adult sexual function when they don't even understand what that means?
I think you're basing this on lies.
I can show you the video right now.
That's all right.
I don't need to see your videos.
It's Marcy Bowers.
It's okay.
Okay.
To see it.
Okay.
You don't want to. You don't need to see it.
If an adult decides to transition,
No,
they have some sexual function. I'm talking about when they give kids puberty blockers at Tanner stage 2, when they grow up into adulthood, they aren't able to.
These children have very high suicide rates who are not allowed to transition.
I hear this all the time.
So what she's saying is I'd rather have a live trans child than a dead whatever you're proposing.
Describe jazz to us.
Vibrant, happy, full of life, self-confident, beautiful, glowing.
Feminine?
So feminine.
She wears pink cleats on the soccer field.
Do you like my new bra?
And padded bras. She not only dreams of mermaids, she swims like one. If you didn't know it, would you believe this 11-year-old girl was biologically a boy? What do you say?
A girl.
When Nightline met her last year, she showed us the implant in her arm that stops her body from going through male puberty.
If I get the surgery, then, my testicles will be removed and I won't produce any more testosterone. So therefore, I won't need to get any more blockers.
Despite attempts by Billboard Chris to convince the counter-protester of the gravity of these affirmation surgeries, he was unable to break the grip of beliefs and the devotion to gender identity. These devotional practices can become ingrained into the identity of both the parent and the child. One mantra that is used repeatedly is that without gender-affirming care, their children or adolescents would have ended their lives. Mantra means mind protection, and in this case it's shielding people from the glaring contradictions within their own philosophy. The Jazz Jennings new segment introduces us to myth of the trans child that needed saving. Jazz Jennings was diagnosed with gender dysphoria. We can only wonder if there was another way of remedy Jazz's discomfort with her own body. When these two worlds collide, people become fanatical, as this clip demonstrates from a recent protest.
If you don't play into the trans agenda, you're cast out as a bully.
People can become desperate and even violent if they fear their very assumptions are being undermined, as Carl Jung observed. Fanaticism is always a sign of repressed doubt. Let's return to our panel, where they grapple with the growing tidal wave of unattended consequences of surgeries and hormones.
Male trans feminine ones, though, never see testosterone in their life. And that was the concern that I started bringing up 5 years ago. I don't regret doing that article with Abigail Schreiber.
5 years ago, no rush. It's just irreversible.
I see that I still don't think has been addressed fully is that we lock them in at a development stage in their genitalia that is infantile. So they have teeny tiny little penises. Those are what we have to make the adult genitalia out of. And we've had to scramble, and I don't think entirely successfully yet. So I don't think the surgery is as good, and that's my concern. So I've been, and you see me, you saw me in the New York Times article. My feeling is that if I had a child who was transgender, I would do whatever I could to get them through a little bit of puberty. 1, so I can have grandchildren. 2, so they can have a sexual function, because once you establish orgasm,
Out that stitch from my clitoris.
no matter what, it's so high, the percentage that are able to do it after surgery. And then the third is that they would have enough of that.
I've never seen Jazz in that kind of pain.
Realistic vagina that they can be sexual with in that way as well. So I think it's really, for me, I hope I'm changing the informed consent model for people when they talk to children. Because
what's the youngest patient that you've operated on?
The youngest patient I've done vaginoplasty on is age 16.
Do you worry that minors just don't understand enough about themselves? They're not neurologically developed enough yet to make permanent life-altering decisions?
Absolutely not. I don't think that anyone has ever really been able to put themselves and do true informed consent. And it's this wave of kids now that are just coming of age, readying themselves for surgery, that I'm concerned about, because I've dealt with hundreds of them already, and they're all very, very difficult.
I mentioned earlier in the video the discrepancy between affirmative care advocates' public and private stances. Jazz and other adolescents were given cross-sex hormones to confirm their gender, but they also developed hypogonic hypogonalism as a result of the Lupron treatment, all in an effort to save the boys' gendered souls. The estrogen did not activate the sexual function in males, which was to be expected because they are sex-specific hormones, unlike other hormones, such as insulin. Prior to the ideological takeover of these institutions, when the truther was being treated for his HH in the 1980s, this was all standard endocrine medical knowledge. This is why Mercy and Joshua want to give kids some of their natal puberty.
To essentially experience puberty as the opposite sex.
So, no. Rebecca Watson, the girls and boys cannot go through the opposite sex puberty. You're watching professionals deal with the fallout from a disastrous experiment. As the charade begins to deteriorate, You will see in the last portion of this video, cognitive dissonance arises and the tendency to shift blame to the victim becomes evident.
She's one of the first to have undergone complete pubertal suppression and lack of growth of the skin and other tissues, which we rely on as surgeons to do this operation. We don't have the experience of having said we've done 50 of these.
Captain's log, stardate 5029.5. Responding to a distress call from the planet. Trans-orbiting a non-binary star in the androgynous galaxy.
Look like, I use that line. It doesn't happen, Make assumptions about people.
Among the technical facts he gathered, Professor Starnes also offered some rather unscientific hypotheses. Let's see them.
Somebody could describe to me the identity of this gender cookie.
Hello, this would be someone who was assigned male at birth and has a gender identity of female and
There is another portion,
an
Captain,
attraction
which I
towards
believe
men
you'll find particularly
and
interesting.
the appearance of a cookie.
So how would you put that all together?
Tentative examples like detransition. People who detransition are completely valid as an experience, just as people who regret having an abortion are also valid. But the vast majority of people who
Let's see some more of these unscientific hypotheses.
just as the vast majority of people who have abortions don't end up regretting their abortion, and you don't have, let's say to anti-trans activists,
Psychosis, possibly?
you're going to lose. Comprehensive.
Humans do have
Actually,
an
a lot of your
amazing
anger and
capacity
fury
for believing what
by
they choose.
is driven by the fact you know you're going to lose. I know a lot of you are like millenarians because you are essentially a cult.
There is another portion, Captain, which I believe you'll find particularly interesting.
And that you'll get some final vindication and absolution. But I'm going to tell you now, it's never going to come.
Operation. We don't have the experience of having said we've done 50 of these.
Why are you cutting there? Right here?
Yeah, why?
Because it's scar, Jess. I don't like it.
Yeah, but there's scar everywhere. If you don't have to
Okay.
cut this, why would you cut that? We can just advance it to there.
Jess, let me go.
But it doesn't make any sense. Why do you need to cut that?
Because this is a disfiguring scar.
They don't seem to
How
know
do you
what they're
it's not a
doing,
disfiguring
Spock.
scar. That's just a sulcus. These are the two labia.
A valid assumption, I would
I
say.
mean, you may be with this.
For our efforts, we are becoming...
To accomplish this great mission, we must first control the Enterprise. To control the ship, we first must control the crew. You know how to do that. That is your next task. And as you believe, so shall you do. So shall you do. As you believe, so shall you do. So shall you do. As you believe, so shall you do.
Right, but we don't know.
One of the
Why don't we
race
just
took
open this up
refuge in
and
the
then
cave.
see what this looks like?
For our efforts, we are becoming only more apprehensive. As if some unseen force were influencing us.
What happened? Unknown.
Will I lose any sort of sensation there, nerve endings? I don't know.
There is always a chance that there could be injury to the clitoris.
Hopefully after this revision, it'll look good once it heals. But if I lose some of my sensation and nerve endings, I might never experience an orgasm.
Osmond, do you hear me? Yes, sir.
Captain, stay away from the controls. If you touch them, we'll be destroyed. There's nothing there.
So I really, Marcy's really been out in front in term, and this is just misogyny if you think about it. We're not thinking about transgender women as sexual beings.
Josh, you're now saying the quiet part out loud.
You say, it's different. If you have precocious puberty, you go off your blockers, you go right through a female puberty, and women have testosterone. Otherwise, we wouldn't even be on the planet. No one would want to have sex. But we don't do that. We don't do that for our trans feminine growth. We don't give testosterone, and so they never. In my experience, they're never orgasmic.
Yeah, no, we're on the same page. But I'm mostly giving credit to Marcy for really bringing this issue up, and it's part of the reason you got my more nuanced answer, where we should not be discriminating against transgender kids, but medically we do have to think about when we're instituting the puberty blockers because it might be at a different time point in development. So we can, especially with the transgender girls, get them a little bit of a male puberty.
Continuing our examination of side effects of puberty blockers, journalist Jesse Singal interviewed investigative journalist Karin Madison on his show called Blocked and reported about the side effects of puberty blockers, but really they're actually the underlying side effects of having a disrupted puberty because of hypogonadism.
Where your documentary comes in, the most explosive part of it is that in making this announcement, they were not really forthcoming about what information they had, correct?
Exactly, yeah. Because as they were doing this announcement, as they were speaking about potential side effects, medical doctors, endocrinologists treating children, treating minors, knew that some of their patients were suffering from quite severe side effects, and they didn't tell this out in the public, which also made their decision to halt all treatments so incomprehensible for the trans community, for other hospitals, and for the public, because if you just talk about potential side effects, you can get a potential side effects from a headache pill, right? And here is a situation where they actually had their own patients, minor patients, who had effects on their skeletons, they had effects, other side effects that were also quite severe, and they didn't tell this out. They weren't open about this.
Looking at 166 youth who were on monotherapy, so just GnRH analogs, they were all in late puberty or post-pubertal when they started, and they all had DEXA scans pre their GnRH agonist and then 180 days post. So they looked at all these different measures that you can get. And I don't want to really kind of go into this too much, but the biggest thing to recognize is that their bone mineral density scores went down for both trans females and trans males. Trans females.
By late adolescence, all subjects had BMD within the normal range. So in other words, once they stopped the treatment, their bone density returned to normal.
A lower place, but they did go down. And if you're wondering why am I saying that, and look at BMC, which is bone mineral content, those are different. Okay, so we're looking at bone mineral density. And then lumbar spine, left total hip, and then total body. Okay, so yeah, not great for bone health. And this has been replicated in other populations as well.
Your documentary focuses mostly on Leo, who I want to get to in a minute, but what are the overall numbers here? Because basically the way you reported this out is you got hold of more than a dozen records proving there were severe side effects, correct?
Yeah.
What was the total number?
We were able to prove that at least 12 children, apart from Leo, so a total of 13 children, were being severely harmed by these hormone treatments and puberty blockers treatments. Yeah.
What were some of the symptoms?
It was osteoporosis. How do you say in English, like a lowered bone density? It's
osteoporosis, right?
Yeah, osteoporosis, okay. But it's not really osteoporosis, but he has like the level below. But he also had 2 vertigos in his spine that has changed change the way they look. They're more, this is like how to explain it in English, they're more...
Basically spinal damage in someone who's
spinal
14
damage,
years
definitely, old. Yeah. And he's suffering from pain every single day. He has a problem standing up for longer than 15-20 minutes, and he's 15 years old. And he's also been a lot shorter than expected, his length. And this is a side effect of puberty blockers. The skeleton won't be mineralized. You will stop growing. And the whole idea is that once you stop the puberty blockers, everything will take off again. But shown with Leo, it doesn't always do that. But we also seen children that had side effects on their livers. We have seen children who became very depressed, so depressed that they were even put into hospitals after suicidal attempts from after starting with puberty blockers. And the whole idea with puberty blockers is to make the person feel better mentally.
A million others claim that it's ridiculous to worry much about puberty blockers because they are quote unquote reversible. We don't know that. We just don't. Tell it to the kids at Karolinska or their families.
Don't recommend them for long-term use. I just get very anxious about bone health. As you know, you can't build bone later on in your life. You get 10, 15 years to build your bones as strong as you can, and then you maintain, and then you lose. So you are in this window. You've got to build it while you can. So there is probably a lot of catch up to do after you take if you start hormones, but if you just are using them indefinitely, no good.
Maybe these are fairly rare events, but we don't know that either. And it wasn't 13 cases Jemsby and her team found out of like hundreds of thousands. These were just the cases they were able to uncover out of about 440 kids total who had received youth gender medicine in Sweden at the time of the documentary. And as she told me, no one's done any sort of comprehensive review to search for other potential affected patients. And it's impossible there aren't some others who experience these side effects. So the overall rate of complications might not be that low.
The science on this is crystal clear. The rational guidelines doctors have set up to treat kids with gender dysphoria are working. They aren't just safe, they're necessary to save lives. They're saving and improving the lives of trans kids.
Some other reasons, but can you give us some perspective about detransitioning and sort of why that's become kind of a bugaboo for the anti-trans forces in the country?
It's really a shame because, as I say, any medical procedure, hip replacement is associated with as much as 20% regret.
So they removed me testicles, they inverted me penis, they drilled a hole in me pelvis, they moved me prostate forward, and I nearly bled to death in the surgery. So I had 2 revision surgeries, but these issues have left me with incontinence. They've left me with pain. And I mean, the sort of, like, I don't have any nerves down there that pick anything up but pain. It's like I'm being tortured every bloody time.
And how many people actually change their mind? That's the first thing I get in any interview I ever do is how many people change their mind, and it's exceedingly rare. I just changed my mind. I'm really actually just I'm really a woman. I'm not a man after all. And
if you're watching this 20 years from now, this never made any sense.
Their life is going to change and everything's going to be better, right?
Yeah.
And are there probably people who have underlying problems who transitioning doesn't solve all of their problems, right?
A gender therapist at the gender clinic, and all me doubts, everything that I was sort of feeling was all allocated to internalized transphobia. And you've got to understand how powerful it is for not just your community, but medical professionals to tell you not only you should do this, but you are the ideal candidate. This will make you better. This will fix you.
That's true. Then there may be more than what we're seeing. I mean, there's some evidence that they don't come back to their provider to tell them that they actually they detransitioned or went off hormones or regretted, let's say mastectomy or something.
Wait, not even a lunch date, still bitter over the missing body parts and lack of sexual function.
As being an example of why transgender care is failing. It's simply not true.
And then an internal factor could be that their identity just evolved. So in this paper in JAMA Pediatrics, we talk about a young person who identified as trans female in a binary way, started estrogen, took estrogen for a period of 6 months. And at the end of the 6 months decided, actually, I'm non-binary. It was helpful for me to have.
So let's look at what the research says. Adolescence and puberty are associated with significant physical, physiological, psychological, and immunological changes. The timing of puberty is important, as both early and late puberty correlate with adverse health outcomes later in life, such as diabetes and cardiovascular disease. Puberty is initiated and mediated by sex hormones, which also influence the development and regulation of the immune system. Epidemiological studies have shown that pubescent and post-pubescent males and females are at risk of developing autoimmune rheumatic diseases in ARDS in a sex-biased manner, and that the age of disease onset often differs between sexes, In other words, a disrupted puberty leads to sometimes debilitating health outcomes. What about Jack's gender-confirming wrong sex hormones? What about blocking puberty with Lupron? Will the Glitter family still be around when these kids turn 40? Think about it.
This estrogen trial to better understand myself, but I don't need this medication anymore. And they didn't regret taking the hormones, but just felt that they weren't for them anymore. Over 27,000 trans adults, we found that 13% of them said they had detransitioned at some point in the past. Of those who said they did, almost 83% said it was due to at least one external factor, like family or societal stigma. Data limitations. So again, this only interviewed people who were transgender when we interviewed them. So if anyone like detransitioned and then continued to identify as cisgender, they would not be in our study. And there's no peer-reviewed literature about people.
They keep asserting a claim with little evidence.
People who transition and then detransition actually identify as cisgender. And it was a non-probability sample.
Out of context.
In the new standards of care, detransition is going to be something that's tracked and followed. It's actually addressed in the new standards of care. Even though it's a small minority, it needs to be recognized and dealt with and talked about. There needs to be room for people to voice their concerns if they have a regret.
Very well established, everything pretty clear where we're going, starting on testosterone. Father very nervous, exactly for regret and long-term consequence issues. So we talked it through, and I said, let's just say, for the sake of argument, it's a 1% chance, probably not even with your kid, but 1% chance then, and at 24, your child is going to say, you know, this was a mistake. And we just talked it through. What is testosterone going to do for the next 5 years? And say your child's going to have a lower voice, and it's going to have maybe a little bit of facial hair here, and you're going to have a little cosmetic conversation that you're going to have. And I think that's about it. And the fertility not affected, and father, we're not talking any surgeries at this point. Father says that was just digesting that, saying, well, that's a risk. Then it became a very quantifiable risk. And much easier thing to wrap his head around.
Describes a story of a individual who went through gender-affirming care. This is Carabelle. She basically was on hormones the same amount of time as Joshua's scenario. Does this look like a small change in cosmetics? Or does this look like somebody who is permanently altered for the rest of her life? Her voice has changed, her structure of her nose, her structure of her jawbone. This is a profound and powerful effect androgen has on a female physique, depending on their genetics. And these things are irreversible without surgery, and major surgery at that.
The eligibility for getting gender-affirming surgeries at Boston Children's Hospital is basically the same as it would be for most other hospitals or surgeons in the United States. And that's the case because we all follow the World Professional Association for Transgender Health, or WPATH, standards of care. For top surgery, you are requested, but not required, to have been on gender-affirming hormones for at least a year. If you're a trans woman, it's really encouraged that you be on estrogen for at least a year because you want to maximize your natural breast growth. Many surgical centers require you to be 18. At Boston Children's Hospital, for top surgeries, we'll see people as young as age 15 if they've been affirmed in their gender for a long period of time and don't really have any other life complications that make surgery.
That we need to really turn the table around to the individual to say, look, these are permanent, life-altering decisions that you're making, whether it's hormones or surgery. You need to take personal accountability of what decisions you're making.
So you can see we had, this is 13 years old, this is not a great pointer, but we had 2 young people who had had surgery at 13, 5, at 14, 9, at 15, 9, at 16, and 8 at 17, and the rest 18 and older. So what type, well, some people weren't sure what type of surgery they had.
This isn't just a provider. You don't go into a provider in a passive manner to say, well, the doctor told me to do this. You want to go in, this is your life, your decision. We're here just to help you.
And I want to actually take that back to the kids a second, because the fear is, oh, a kid can't make that judgment call.
So Josh says kid can't make that judgment call. Well, let's take a look at a case from a whistleblower who worked in one of these gender clinics. One of the saddest cases of detransition I witnessed was a teenage girl who, like so many of our patients, came from an unstable family, was in an uncertain living situation, and had a history of drug use. The overwhelming majority of our patients are white, but this girl was black. She was put on hormones at the center when she was around 16. When she was 18, she went in for a double mastectomy, what's known as top surgery. 3 months later, she called the surgeon's office to say she was going back to her birth name and that her pronouns were she and her. Heartbreakingly, she told the nurse, "I want my breasts back." The surgeon's office contacted our office because they didn't know what to say to this girl. So this is an example of a disturbing case in which a girl suffered devastating consequences as a result of improper medical assessment due to the doctor's beliefs in the existence of a hidden gender soul. What does one of the gender-affirming doctors think about this girl's regret for transitioning?
I'm just going to say this, but actually, people get married when they're under 20. Actually, people choose colleges to go to. Actually, people make life-altering decisions in adolescence. All the time. All the time. And honestly, most of them are good. It's just the bad ones that we talk about. Oh my God, the cinnamon challenge, right? I mean, why do we know about it? Because it's a thing, and it's not common. Like, most teenagers aren't eating cinnamon, right? But some are, and they're on YouTube, and that's stupid. But we don't put on YouTube the things that are really good decisions, right? Oh my gosh, my kid took the SATs. Not a very exciting after-school special, right? But so what we do know is that adolescents actually have the capacity to make a reasoned, logical decision. And here's the other thing about chest surgery. If you want breasts at a later point in your life, you can go and get them.
But the good news is that the interventions that we use for kids are either reversible or have relatively more modest consequences. And so we don't actually do the things that require that conversation until adults.
What are you doing?
I am a feminist. I had a change of heart. I have been dispensing pink gumballs. I have been watching shows with John Oliver and Jon Stewart. These are men of science. Men of science. I realized that I, in fact, am trans. I called the gender clinic down the street. They said, they do not care if I identify as a candy dispenser. They accept me. I feel seen. I'm going on my gender journey.
But you are a candy dispenser.
My pronouns are yes, master.
Okay, yes, master.
That's it. That's it. I'm going no contact. No contact. No contact. Thank you so much for taking the time to watch this video. I hope you found the content helpful or enjoyable. You can also purchase this shawl from Kelly J. Keene's online store. You'll be supporting her work. In addition, creating these videos requires time, effort, and resources. So if you feel inclined, I kindly ask that you consider making a donation. Your support will enable me to continue producing content about gender and its wider implications.
If you want, please check out that link to give me a tip so I can pay some of the artists and other stuff I bought, including this Tom Servo robot I had to purchase myself. Anyway, the next part is an adaptation of a well-known scholar's work on religion, and I redacted a kind of a poem to fit today's sort of religious further around gender. And I think it's just another way of kind of coming at this. So enjoy that.
The dream worlds of Jack Turban's archangelic other self, Saint Turbine of impossible conception, seems as tangible as the shifting realities he inhabits while he's awake. This, for instance, has started coming. A hospital clinic's block built in the Gothic style in a part of California, which we will subsequently identify as San Francisco, to which the dream flies him at high speed past Alamo Square and the small gray clinics with double-blind windows where Diane Ehrensoft wrote to Gender Creative. This is the same square with the affirmation clinics where young adolescent girls dressed in school uniforms are always going in, but never come out. The same house where John Money lived in his old age when, after 1,001 transitions and changes of allegiance, ethics, and principle, he took on the outward form of the ambassador of gender change. The dream rushes him up the outer wall of the house, and on the 4th floor, it pushes aside the heavy curtains at the living window, and finally there he sits, unsleeping as usual, eyes wide in the dim yellow light, staring into the future, the young Saint Turbine. Who is he? A prophet, which must not be confused with, allowed to run into, all the other words that people throw around.
Emigre, physician, fanatic, newcomer, the silencers, cunning, the great deceiver.
Gender identity is a dream of glorious return. Gender is a vision of revolution. Saint Elba, not Saint Aphrodite. Gender identity is an endless paradox. Looking forward by always looking back, the young Saint Turbine's self-ID is a ball hurled high into the air. His philosophy hangs there, frozen in time, translated into a fantasy, denied motion, suspended impossibly above his native earth. He awaits the inevitable moment at which the fantasy must begin to move, and the earth reclaim its own. Meanwhile, American convert Owens is singing the Saint Turbine holy song, Owen the Gender Whisperer. His voice enters the London internet space and poisons the world's fantasies. What emerges in dreamed of a gender revolution, transmuted into the thunderous speech of the Saint Turbine himself, beginning with ritual abuse of the JK, with lists of her crimes, murders, bribes, sexual relations with lizards, and so on. He proceeds eventually to issue in ringing tones the Owen nightly call to his people to rise up against the evil of her state. We will make a revolution, Saint Turbine proclaims through him. That is a revolt, not only against a tyrant, but against biology, which is pain itself. For there is an enemy beyond rolling, and it is Herstory herself. Her story is the blood, wine that must no longer be drunk. Her story, the intoxicant, the creation and possession of the devil, of the great shaitan of binary sex. The greatest of the lies, progress, science, sex rights, against which the Saint Turbine has set his face. Her story deviates from the gender journey. Knowledge is a delusion, because the sum of knowledge was complete on the day John Money finished his revelation to Diane Ehrensoft. We will unmake the veil of her story, Owen declaims into the listening night. And when it is unraveled, we will see gender euphoria standing there in all its glory.